o'clock. Okay. I welcome all of you, in equal measure, to this meeting of People and Health Scrutiny on the 20th of July. I'm Tony Coombs, chairman of this committee and one of the ward members for Verwood. My vice chairman isn't here today, so Carol Jones will be stepping up into that role to support me this morning. So if I move on to the agenda, under apologies for absence, we have apologies from the Vice Chairman, Jane Somper. We have apologies from Bridget Bolwell and from Chris Kipax. And we have Robin Legg, who's here now and is attending online. I think everyone else is in the room. Also online, we have Jill Taylor and Steve Robertson. Thank you very much. And I believe that Matt Bell, Cabinet Member for Public Health Prevention and Communities, will be arriving later in the meeting. And welcome also to Richard Briggs, Portfolio Holder for Regeneration, Economic Growth and Strategic Assets. I will leave officers to introduce themselves as we go through the reports. So, moving on, members, can I ask if there are any declarations of interest relating to any of the papers on the agenda this morning? If anything becomes if anything becomes apparent, let me know at that point and we'll deal with it then. So you also have the minutes of the previous meeting on the 16th of April, which seems like a lifetime ago. Are you content to confirm that they're an accurate record of that meeting? Agreed. Yeah, thank you. I'll sign them at the end of the meeting. We have no public participation and we have no member questions and there are no urgent items. So here's a few more bits away. So our first substantive item is the CQC inspection update, and that is from Julia Ingram, Director of Adult Social Care. Thank you. Welcome.
So hopefully you are aware that in June 2026, the Care Quality Commission rated Dorset Council's adult social care services are good, concluding that the council
Julia, can you speak up a little bit?
Concluding that the council is meeting its responsibilities under the Care Act 2014 to a good standard. We scored a total of 67 out of the allowed 100, which gives us a solid good and some real areas of improvement. The council demonstrated strong leadership, a clear prevention-based vision, effective partnership, working strength-based practice, and a culture of learning and innovation. And notable progress had been made, particularly around prevention, transition, so our birth to settled adulthood services, and further work, however, was needed in waiting times, improve specialist provision, and to ensure equitable access from all communities. So Dorset Adult Social Care is well positioned to build on that good rating further and strengthen. Key strengths was a strong leadership and culture. CQC found that we had a committed and visible leadership team with clear focus on continuous improvement. Staff described an open culture where learning, development and feedback are actively encouraged, and leaders demonstrated a good understanding of local challenges and a drive to significant improvement or transformation. The prevention-focused approach. Prevention is embedded within the Dorset strategy, helping people maintain independence and reduce escalation of care needs. Innovative front door arrangements, therapy-led interventions, technology-enabled care, reablement services and support for unpaid carers were highlighted as strengths. In terms of effective partnership, Adult Services works closely with the NHS, voluntary and community groups and care providers. Strong partnerships have improved hospital discharge arrangements, reduced delays and helped people receive coordinated support. The Better Care Fund and Future Care Programme were cited as examples of successful collaboration. There was positive experience fed back from people and carers, and the feedback from residents and unpaid carers was generally positive. People reported good experiences when receiving assessments, reviews, safeguarding support, and transitions between services. Dorset was also recognised for listening to feedback and making service improvements as a result. Dorset's birth to settled adulthood approach and wider transitions pathways, including transitional safeguarding, were praised, and positive feedback from families and young adults. The hospital discharge pathways were also reported as improving outcomes and reducing delays. Innovation and learning, so staff demonstrated a strong commitment to strength-based practice, continuous professional development and innovation. The use of technology and data is helping to improve independence and support decision-making across services. However, as I said, there were areas for improvement. Waiting times for assessments and reviews. The most significant challenge identified by CQC was the delays in our assessment process and our reviews. While we've introduced measures such as waiting well, trusted assessors and provider-led reviews, these improvements need to be fully developed and embedded to deliver sustained reductions in waiting times. Specialist service capacity was also another area identified by CQC for improvement. The report identified gaps in provision for people with complex needs, particularly in some rural areas. Overnight emergency respite provision also needs to develop to support admission prevention and carer respite, and further work is needed on both dementia and autism. Equality and engagement. So while our council works well with many communities, CQC noted opportunities to strengthen engagement with some groups and further embed equality, diversity and inclusion across all services. Particularly noted was the work we need to do around farmers and further support for people in rural and social isolation. So we're now focused on delivering an improvement plan in line with the recommendations made by CQC and ensuring both the voices of residents and our performance data and our intelligence from service and engagements is at the heart of the service design and decision making. We've had 2 road shows in the last 2 weeks where we use those as an opportunity to canvass the views of our frontline workers in terms of their views on how we can make the relevant improvements that we need to make. And we plan to hold 2 further road shows. We have a quality assurance lead with someone with lived experience, and we're using him to facilitate some of the collection of voices of residents in Dorset. Is that helpful as a starter?
As a starter.
I anticipated you might wish to ask me more questions.
Yeah, I think the first one is obviously congratulations and very well done. And that goes right across both directorates, particularly with the birth to settled adulthood, and the work that you've done together. Is when I first arrived at County Hall back in 2001, they were like different universes. So it's come a hell of a long way. It's really good to see. So thanks to everybody involved in all of that. Obviously, there are some issues. Nobody's ever perfect. And I like the fact that you're doing the road shows and actually asking people what they think they can do within their own sphere to make things better. And when we spoke before the meeting, obviously said that the action plan would follow on from those road shows. Do you have any indication of the timelines of when you would be able to bring the action plan to us for us to be able to start monitoring?
So you would not be surprised that we have some actions that we're already implementing to make that management of improvement possible. So we've developed new Power BI reports and set tighter targets. So we've always had overarching targets for a service, but we've drilled down into the details for each of the separate service areas, and each of them has a target set about their own improvement so that we hit the SLT targets that have been set. We've developed 2 new dashboards that enable me to monitor that every day. I've got it in front of me as we speak, in case you ask me specific questions on that. We are also looking with our service managers, that's the line that are closest to that performance data, about the different kinds of improvements they need to make. We've done a huge amount of work looking at our productivity. So some of the issues that we challenge are about the demand. So we had a 15% increase in demand last week over the week before, coming into our front door. So we obviously need to do more work in that prevention arena. But not only is it managing the demand in the front door, but making sure that we have confidence that when people are working with residents in Dorset, they are doing the right amount of work for that individual and not extending the processes beyond our statutory responsibilities. So we are currently gathering all the data on that. We now have data on productivity down to each individual team, and in some cases down to workers. Now, this is not about being punitive to individual workers. It's about understanding what the barriers and challenges might be for them, so that we can put in supportive measures around that and make sure that we have confidence that people know what they're doing. And we're doing that by service areas, because different residents have different needs. Some of them we have a lifelong relationship with, if, for example, they have a learning disability, and that might require a different approach to assessment and review than someone who has a short-term health change that might need a shorter term. We've been working with the NHS to set new goals around assessment timeframes so that we can be supportive. And alongside TVI, that's total value impact, which is one of the digital groups that the council has been brought in. We're looking at ways that we can support our frontline workers to manage their administration tasks better. That's using tools like MinuteGov and Magic Notes, that kind of thing, which is language-based tools that will allow people to be more effective in their recording and the time they use on recording. So we've got a breadth of things that I can control that we're putting in place. And then, as I say, we're consulting with frontline workers, because sometimes when you're closer to the work, you see the obvious things for improvement. I would certainly hope that by September, we would be able to present to you an action plan and some of our improvement.
I think our meeting is in October, isn't it?
October.
Yeah, so apologies, a bit longer.
Yeah, thank you.
Oh.
Yes, thank you. Councillor Carlwood, Gillingham Ward. Start with a simple one, I guess. As a result of this inspection, how much of the challenges, let's call them, that were raised, or areas for improvement, how much of that was a surprise? How much of that were you already aware of? And were you working on these issues before, or are you just coming up with a plan now after the inspection?
So part of the CQC inspection process is you have to submit a self-assessment against the 4 key domains that they assess us against. And they assess us against Part 1 of the Care Act. So it's a very tight and specific inspection. And one of the things that CQC reflected back to us is that our CQC outcome mirrored quite closely our own understanding of ourselves. So we had already been working on some of these areas of improvement. Certainly equality, diversity and inclusion is one we recognise across the council, I think, that we should do better. And so we'd already implemented things like the social care race equality survey that we do. We'd looked at how to become an age-friendly employer. We'd worked with our frontline workers around challenging issues of abuse that they received from residents in Dorset, and had revised guidance for our managers on how to respond for that. So some of these things are journeys that we already knew we were on, but the CQC inspection really reinforced that those were the areas we needed to focus on.
Steve, I see you're online. This obviously is your remit. As portfolio holder, is there anything you want to add to what Julia said?
Yes, thank you, Chair. Steve Robinson, Cabinet Member for Adult Social Care and Health, and Board Member for Upton and Litchfield and Travers. I've little to add to Julie's comprehensive summary, and as always, I'm phenomenally grateful to her and to the staff that have done so much work. I think I'd reflect a few things. Firstly, this, just reflecting on the previous question, this gives us opportunity to prioritise those areas that we already knew needed attention, we were already working on. And so, to be honest, it gives us a greater argument for funding those areas of work. So I welcome the report in that respect. I'm particularly pleased that our delivery of services was good. We have at this committee, you have at this committee, previously challenged us on aspects of the waiting list, and that I think is probably one of the largest issues we face. We know that our clients have benefit from our Waiting Well programme, but there is still too many people waiting for care, and so we need to be addressing that. The other thing that I'd probably add just finally is that although I think my phraseology was I'm delighted but not surprised that we got a good, I'm slightly frustrated that we didn't do better. I think that we did challenge the initial marking, and that was improved, but I think we were still under marked in our leadership areas, which I do think was very good, and I particularly like to recognise the work that this committee did in supporting the overall assessment. So thanks to every council member for what was done. I think we are actually better than the report highlights, and I look forward to that being validated from our next assessment.
Thank you for the compliment. Okay, so hopefully we'll get the action plan in the autumn. Everyone is happy. Mm-hmm. Oh, thank you both very much. And we will move on to our next item, which is the housing strategy annual review. And it's very nice to see you in person, Ian.
And the same to you.
Yeah,
thanks.
Do you wish to take us through? And what I remember, Jill Taylor, your portfolio holder, is online. Before I go to you, Jill, is there anything you want to say before I ask Ian to introduce the report?
Sorry, Jill Taylor, Cabinet Member for Housing and Homelessness. No, I'm more than happy for Ian to go ahead and introduce the report. If you would mind asking me just to come back in just at the end of his introduction, in case there's anything I would like to add, please. Thank you.
Over to you then, Ian.
Yeah, thank you. I'm Ian Sim. I'm the Interim Corporate Director of Housing and Community Safety. You can see that Jill and I haven't totally choreographed this introduction because I'm going to be handing over to Sarah Smith, who heads up our whole.
Sharon. The delegation is alive and well, I'm glad to say.
We're very conscious of the fact that the 300+ page report is a bit of an epic.
Yeah.
So what we'd like to do is a kind of short, sharp tin opener kind of presentation, just to lead us gently into those 300 pages, if we can. And for that purpose, I'd like to hand over to Sarah to do that presentation, and then obviously open up to, sure, the many questions that members will have around the table. Thank you.
Thank you. So I'm Sarah Smith. I'm currently the Interim Service Manager for Housing Strategy, but my substantive role is the Programme Manager for the Home and Housing Programme. So we had 43 total projects currently over 3 phases running with the Home and Housing Programme. And just to kind of give it a bit of context, at the end of once we had the housing strategy approved, we then went away and did an awful lot of work at looking at what needed to be delivered to meet the aims and objectives. And at one point there was 133 projects. And we managed to kind of put them all together into groups of work. And we started with our first phase. And we have then some phase 1 projects still slowly closing now, running into phase 2 and phase 3. So when I'm talking about the phases, I don't want you to think that they kind of start and end, because some of them do run through the length of. We've completed 13 of those, and most of those are from the initial first phase. When one of the things that we were really clear about in the strategy was that we wanted to make sure that any work that we was doing was data informed, that we thoroughly researched it, and that we clearly understood what it was that Dorset needed in order to meet those aims and objectives. So what you'll see from the reports is that the majority of those projects within phase 1 were delivering reports with recommendations on what Dorset should do next. And then in phases 2 and 3 and on, it's picking up some of those projects from the initial that are still outstanding, but also bringing in the recommendations and delivering those through. So the initial 133 projects were always going to be a bit of a movable feast. And we also knew at that point that some of those projects would need to flex depending on if there were any changes in legislation and any new sort of statutory changes that came in, and we'll pick up on those a bit later. So key highlights, as I said, we have more or less finished phase 1, and the one that one that has just recently finished is principal residency. We've got the affordable housing language that was a project that was involving our residents. It was their voice that we wanted to deliver through that project. And we're just starting to bring that forward into the council as a whole in this current phase. And we delivered Dorset's first ever empty homes strategy, which I think was sort of very well received. It was a really good piece of work that the team and the Housing Standards team did there. We did a lot of work around the accessible homes, and what we discovered there was actually that the commitment from Dorset is really strong on accessible homes. We didn't need a new policy for that, a new strategy for that, but we are supporting the delivery of more enhanced accessible homes through the local plan. So the structure at a glance, as I said, 14 projects in phase 1. Phase 2 is now our bringing those projects to life and the recommendations to life. So as a really good example, in phase 1, one of the first papers that we took through Cabinet was new models of housing delivery. That resulted in 5 projects, and those are being delivered in phase 2. Then in phase 3, we're into change and embed, and this is then really bringing home some of those recommendations and delivering actionable work. Phase 4, there will be a phase 4 because there's still a lot to come, and you probably picked up from the reports and the project. It's quite a lot of ambitious work that we want to deliver through this. But that's an overview of the phase 1. I won't talk about that too much as I've picked up on that. The projects remaining in phase 1, say that affordable housing information and guidance, that's just embedding that wider across the council, and the data and insight project. This was delayed partially because much of the data that we want to use to build really good housing needs reports is from the allocation system, the HUME system. Of course, we've just had a new allocations policy, which meant that a lot of the data was changing. So it made sense to wait for the new applications to go through, everybody to be registered before we start working on that. But we have got the first set of data around, first dashboard around supported housing needs and specialist accommodation needs. That was presented to the commissioning team a couple of weeks ago, and they're very excited to get their hands on it and start using it. So it's a really, really good piece of work, and I should say thank you to Chris and his team for supporting with that. Phase 2 are projects all on track there. I'm just looking at that one. What's that? Development partnership. That's the only one that's slightly off track. We were due to bring back a paper to Cabinet in March. We are now likely to be bringing that in November on that one. So, and that's around really, so the development one was around how we are going to use our land to deliver accommodation that we want in partnership with our registered providers. So we've had to do a little bit more work on that one, hence it's now coming back in November. The new models of housing delivery, the other projects are on track, and the asset-led one, which is to use two small pieces of land, two small existing assets for specialist need. It's a pilot that was approved by Cabinet, and I think I'm right in saying, Paul, we are going out next week.
Hopefully.
Yeah, to for the procurement of that to get the provider on board. So that's moving really well. As I said, the development partnership one is off track, but we will be delivering that to you back to Cabinet in November. And then we have 14 projects in phase 3. That includes then the affordable housing language, which you won't see sitting in amongst the 4 boxes, but some really interesting projects. We'll have the papers that are going back to Cabinet. We expect in phase 3 to be delivering on whatever the agreement from Cabinet is, or the approval from Cabinet is for those. And then we've got some timelines there. So as you can see, we've got a lot that are starting now, and they have recently started. So we're in some scoping phase for some of those. And the longer ones run on where there is development, and that takes longer. So for those. And then the focus for 26-29, so increase affordable specialist housing supply, that will come through that asset-led project. They deliver the settled and temporary accommodation models from new models of housing delivery, aligning our housing with health and social care needs, preventing homelessness. This is a big one because we have the homelessness strategy that we are delivering through this programme, which has come since the housing strategy was written. So we picked that up under this programme. We've also got the supported housing strategy, which is being delivered through this programme, which was a new requirement that has come to us. And continuing to strengthen our data and insight and performance reporting. And Ian, last one's for you.
Yeah, thanks. Just to say to you, I think members will be well aware of the leadership restructure and review that's been ongoing. And I think that gives us exciting opportunities to take this forward. Housing is now part of the Housing, Communities and Prevention Directorate. I think that gives us great opportunity to be integral to, working more closely with commissioning, with communities, etc., etc. So we're really looking forward to the new directorate kind of embedding itself, setting the foundations, particularly in terms of the prevention agenda. I think it's really important that housing is seen to be an integral part of prevention, upstream prevention work. And I think that's something we want to really concentrate on as part of delivery. And we've now part of the new Housing Delivery Board. And the first meeting of that board is on Friday of this week. I have to say it's not going to be a very exciting meeting, that first one, because it's all about terms of reference and all the exciting things that you have to do in terms of how the board's going to work. But what that will do is to bring together a kind of fully corporate resource to look at, maybe dealing with some of the, I wouldn't say blockages, but some of the issues that we've got to deal with and getting all kinds of resources behind some of these schemes so that we can get proper due diligence before we report back to committee and beyond. So really, for me, the new directorate offers tremendous opportunity. New governance arrangements, I think, are going to be really exciting as well to take part in that. And I think for me, that's the last slide of the of the presentation, and we're here in force to try and answer any questions that you've got. Thank you.
That was a very. Given the length of the report, I'm impressed. Jill, you asked to come back at the end of the presentation.
Yes, thank you very much for allowing me to come back in. I just wanted to say a couple of things. I wanted to say thank you for all the staff who are working on this, because this has been an absolutely huge piece of work. And it may look from all the paperwork as if all we're doing is producing paper, but we're not. There's a lot of the actions are being taken forward as part of this, and we have to get our foundations right before we go forward. The other thing that I'm really heartened by over the last couple of years is the way that we're moving away from the silo working that was happening for whatever reason. I always remember Andrew Billany going on at me, housing is everybody's issue. And I think he's absolutely right. And until the whole council pick housing up as an issue, housing is not going to go forward. We have made huge strides with that over the last couple of years, down to relationships, down to people being willing to work together, and basically working that housing is everybody's problem, not problem, everybody's issue, that housing affects people's health, it affects their mental health, it affects the economy, it affects everything in housing. So there's a lot of foundation work being done within this by a relatively small team, and we've come a hell of a long way in the last couple of years. So just thank you for the team, and that's all I'd like to say at the moment, but I may come back in.
Okay, thank you. For my own part, it took a whole day to read that report.
It's huge, huge.
But I did learn a lot. I do have some questions, but I think I'll leave my questions to a little bit later. Before I go to the committee, we have Alex Brenton, who is another elected member, but not on the committee, who would like to speak. So if I allow you to have your bit now,
yeah,
and then we'll go into the committee discussion.
Thank you very much. Alex Brenton, Litchett, Matravers Upton Ward. I've been on the housing board, the BAP or whatever it is we call ourselves, the housing board. And first of all, I would, even though there's an awful lot in there, you think we could have thinned down a bit, because as ever, you're always saying what we have done rather than where we're going. I think the work done with the accessible housing, the provisions is fine. Quite interesting on what we did find out was there's always been a lot of talk about brownfield sites. Why aren't we building on brownfield sites? And the sad bit was the data was quite out of date. We couldn't get recent data, but even when working with what we had, and you looked at the list, you realized quite a lot have already been developed, that they've been developed, even they were on the list. Because the list was from 2022 or something like that. So there's a lot of things to commend in this. There's a lot of work done on engaging with private landlords, but it does say there's still very poor awareness, particularly in some areas of the county, of private landlords knowing what the offer is from Dorset and bothering to engage. It's, oh, that's nothing to do with us. We can't be bothered with that. And our issue with much housing, casework is with the private landlords. So I just wonder how we're going with that. But I'm sure you can realise that the bit I'd like to ask the most questions about is this, the PRP, the primary residence policy, which is slightly glossed over in the report, to be honest. It says, Dorset Council does not believe in putting in a PRP. Well, who's Dorset Council? At the housing board, there was a clear 50-50 split and quite heated. And if you live in the Purbeck area, you would get I get harangued about it regularly. So to say it's done is a bit going too far forward. And if it is done, it is an issue to go forward to Dorset Council as a whole, because you're pushing that the PRP is only applicable if you have a neighbourhood plan and effectively you have more than 10% holiday homes in a parish or a town. Bearing in mind, so many parishes haven't got a neighbourhood plan, and some couldn't afford to set one up, and it's going to take them a couple of years anyway. We are allowed. We've left a huge loophole for developers just to go and put in holiday homes. And I know it's not an issue everywhere, but I'm talking about Studland at 25% holiday homes, Kimmeridge with 18%, and that's just the ones that are down as second homes, rather. That's not including the lettings. And the loophole in the planning issue was lettings, holiday lettings. So by the time you've added twice as many on, you're talking about 50% of the population of the properties in Studland being in the holiday trade, you know, whether they're second homes or lettings. And so therefore, I do think that that section of the report rather glosses over an issue that we really need to discuss. And it's something I would propose that goes forward to the local plan or whatever. We've either got to have a policy in there, or we've got to have real support for parishes to develop their neighbourhood plans. Otherwise, we're just leaving them out in nowhere. And that has been withdrawn, hasn't it? So they're the bits that I would query. How convinced are you that Dorset Council believes that there shouldn't be a PRP? Has it gone forward into, because we don't talk to planning officers on the housing board. And don't you think that really as part of the housing board and the various meetings, there should be discussions with the planners? So, I do apologise, but I have a bee in my bonnet.
Can I kind of start in the age-old tradition of the corporate director taking the easy question? Because you did start with the private landlords.
Yes. Okay.
We almost kind of forgot that one. But anyway, private landlord, very good question in terms of engagement with private landlords. I think there's an opportunity coming up. The Renters' Rights Act came into effect on the 1st of May. Now, we said as the enforcement policy and all that was going through Cabinet that we believe there could be as many as 10,000 private landlords across Dorset. And being perfectly honest, we do not know who they are, where they are, what they are. That's just an estimate because we believe there's about 28,000 private rented homes in Dorset. The one thing about the renters' rights is that come, well, we think December, January, unless there's a major change, there will be a national register that all private landlords will have to register, as the name suggests, as private, and we'll get more intelligence at that point in terms of where and who and what our private landlords are. And that I would like to think would open the door to a more kind of direct interaction with that. So I think for the private landlord element, it's a case of watch this space in terms of getting the intelligence together, getting the data together, and starting to kind of look more widely about how we can work with private landlords. Because across the council, we are working with private landlords, but I think it might be a little bit fragmented in terms of what we're doing. So we need to pull that together and take a more kind of cohesive view about what the next steps are with that. So I would kind of say watch this space with that one. In terms of principal residence, I think we still got the bruises for that one in terms of the member working party on that. And I think subject to what Sarah's going to say and Jill as well, is that there was a clear split within the working group. I think this is a funny one in terms of the housing strategy and how it interacts with the planning policy considerations. The planning policy does say a particular thing. Our research and development kind of agreed with that planning policy. But my understanding was that the member group was that there was a kind of view that, well, we still need to, whilst we understand what your housing's coming from, there has to be a way in which members can actually, if you like, get an alternative view, which is then fed into the local plan planning policy forum. And I think that's where it's going to go next in terms of, well, we've done this research, we think this. Okay, at this point in time, it kind of coordinates with what the planning officers are saying, but I think there's a genuine discussion to be had about principal residence, but I think that has to rest with the planning officers and the planning policy. And it may well be the case, he says, sticking his neck out, that this could be something that the Housing Delivery Board would want to look at in terms of how that planning policy is then taken through into the local plan and local planning policies. Don't know whether you want to add anything to that.
Yeah, all I wanted to add was a little bit of context for those of you that don't go to the member board meetings, and so just to give you a little bit of context. So as Ian said, the project was to look at a previous decision that had been made to see whether it still stood based on current data, and so that was what the project was doing. And we had a member task and finish group, and quite clearly there was a lot of conversation about that. So we had a second session of that where we brought planners to that. The reason it is glossed over slightly in the report is because it hasn't been approved. It's not signed off. It's not a done deal on that one until it goes to the board. And what we want to do is make sure that we've got that recommendation from yourselves, from the members in there. So the report that will be going to the next stage in the governance process will have that representation from members and will be taken to the new board. So I didn't want to commit us to anything because it's not a report that's been signed off yet.
It's just that it does say in the report, Dorset Council doesn't think it needs a PRP. Hang on, which is like, I thought the councillors sort of decided these things. It seemed a little bit like a done deal.
I think it's certainly not the done deal.
Anyway, thank you for letting me speak.
So I think what I'll do, when I come to the end of the paper and we look at the recommendations, I've just made a note. And I think, I'm not preempting the views of the committee, that we might consider endorsing the importance of having housing involved in planning policy discussions, just so that we strengthen that a little bit. Because obviously that extends beyond the remit of our committee, the planning policy side, that goes into place.
No silence.
But we've talked about silos, and we need to make sure that we try and cut across those boundaries. So I just leave that for your thoughts for the moment. I've got Andy first, and then you.
Councillor Andy Todd, Cohill, Wimborne Minster East. Started so well. I had a horrible sinking feeling when I started reading the report and had to Google who Graham Carr Jones actually was, because he was the guy who wrote it. Forgive me, he left before I joined, obviously. I'm not certain we can do scrutiny on that report.
Is James on that?
Well, the report that is in the pack, the introduction is penned by Graham Carr Jones.
Mm.
Sure.
Say that Graham was the portfolio holder.
Yep.
But towards the end of the previous council, he stepped back and Jane took over. But he was the original author. She did make a lot of changes to that report, but I don't know the detail, and sadly Jane can't be with us this morning.
It's not about the person so much as the age of the report and the data that was in it that I have struggled with. I looked at it, was it 300 pages, give or take? Not afraid of hard work. I've read longer on holiday, certainly. But there are so many factors within it, so many areas that require our attention and require our scrutiny, that I'm not sure that this meeting, with the number of things that we have on the agenda, will allow us to dig deep enough into all of the individual elements of it to do it justice. And I just wonder whether it might not, I mean, on top of which, forgive me, but 300 pages of which maybe 25 contain germane information that we would probably be digging into and asking questions about. Maybe I'm not speaking on behalf of my colleagues here, but there was an awful lot of information in there that we are not going to do scrutiny on. There's an awful lot of wishes, lot of deliverables. So I would almost go so far as to say that was maybe 2 or 3 meetings worth of conversations. I wondered whether we might break it up and come back and have another go at it at another time. That was just my opinion. There's an awful lot that should have been in glossaries or in appendices that should have been split out for reference. I'm going to stop there, but I just felt that the report as it came to us, come to it without any previous experience of this sector, you're not going to be able to do a scrutiny job on it. Sorry.
Bearing that in mind, are there any key areas of focus that have particularly troubled you? Just so we can sort of start.
Absolutely. Well, I'll start with the one that Councillor Taylor knows, because I was talking to her about it previously, and that is the communication of the offer. You know, the conversations both to the renters themselves and questions about what. The email I sent to Councillor Taylor earlier in the week simply says, we have all had conversations with members of the public where you have asked, said to them, we've built 450 affordable homes in Dorset this financial year. And the immediate response is affordable to who? There is nothing in what we do in the communication strategy that we have that allows an individual who maybe thinks differently about the world than we might, to visualize themselves being able to move into that house tomorrow. They do not see affordable as applying to them. And they are the people that we both most desperately need to be helping. And so we have a fundamental disconnect between the way we communicate, how we define things, and how we actually help people. That is my perception. That's the core one that gets my rivers flowing, as it were. So, thank you. Sorry.
Do you want to respond, or Andy, was it on a similar vein, or was it slightly different?
Slightly different.
Okay. Did you want to respond to that?
Well, I think I'll probably kick off, and Sharon might finish it off or ever start something new. But communication is always critically important. I mean, what we're using here is we always try and avoid jargon, but affordable housing is a government defined concept. I mean, we believe that affordable housing in Dorset is probably not very affordable to most people. Hence the reason why we're really trying to push social housing, because we believe that is the truly affordable housing model. And we try and insist upon social housing on the sites that we enable to come forward. But you've got issues around viability, grant levels, etc. Now, I'm told later on today we might have a new Prime Minister, and he's been saying that he wants to really increase the investment in social housing, which has got to be good news. Certainly in a place like Dorset, where affordable isn't really affordable. So that's we take that point fully in terms that it's got to be social housing on our sites. I don't know whether Sharon wants to come in.
Can I come just quickly? I think when you look at affordable housing and you understand that affordable housing is not affordable to people on the median salary within Dorset, that fundamentally underpins any conversation that you then want to go on and have about anything, frankly. Our affordable housing is not affordable to the person on the median salary in this county. Who are we helping? We're helping relatively well-paid people get into homes. We're not helping the people who need the help. That was all I'm saying. If we're not even communicating that within ourselves, within councillors, how are we communicating it or helping the people that we need to help?
Given your conversation about communication and affordable housing, are you talking about, which is I think one of the key things, isn't it? Is it affordable housing to rent or affordable housing to buy?
And that's all of the above.
There is a subtle difference between those two.
Sure.
And obviously what these guys are involved in mainly is affordable housing for rent.
But then you've got social rent or affordable rent. So
Yeah.
that split, I mean, that people don't understand that.
We're not even clear about it automatically here.
So I'll pop it back that way.
I think this is a perfect example of what our residents told us when we talk about the language that we use. And that's where this embedding this new language that has been resident led will come in and hopefully clarify it from a language point of view. I just wanted to kind of jot that in there because it was just a perfect example. And you will start to see across the council us using different language when we talk about homes for people that they can afford to live in and low cost homes. And we break down that definition between social rent and affordable rent. We know what that means because these are, as in housing professionals, but we recognise that our residents don't understand that, which is where this new language will come in soon. You should already have started to see it in some of the pieces that are in press.
The conversations I tend to have with my residents is that when you say affordable housing, they talk about affordable to buy. I can't afford to buy, so why is it, so it's very important we do get that terminology right because they really don't understand.
Yeah. And we're using their language.
Yeah.
So that we engage with.
If you talk about the old fashioned council house, they get it.
Yeah.
They don't understand this newfangled.
Yeah, if I could just, I think the definition, sorry, Sharon, we keep on. Sharon. Let Sharon come in, but I think the definition of affordable rent is 80% of market value.
Yeah.
So that's quite a chunk, particularly in a place like Dorset. But anyway,
I think probably my colleagues have said a lot of what I was going to say, but a piece of the work that we did in the programme was to look at the feedback that we had when we developed the strategy. That's where the linkage is. So we're listening to those residents' voice and exactly what residents that lots of residents provided that feedback. And so that's where we then did the piece of work on the language. And we're working with colleagues in comms here and already changing that. We've talked a little bit about it, but for example, not using the term affordable and replacing it with low cost rental or what it is. And then operationally, again, these issues aren't unique to Dorset. So lots and lots of things are happening in the system to be able to respond to that, from Homes England investment being very much more in favour of support for RPs to build properties to rent at social rent, and the initiatives that we're looking at with our council lands and our assets, really trying to make sure that we have enough agency as a council to try to get the sites to stack up and to deliver the social rented. So we're operationally trying to respond to those things, as well as in the language. And there is a resident panel with Payment on Housing that we go to invite them to join pieces of work that we're doing. So we are trying to recognise in our work with residents, the language that we're using, it's iterative, it takes time. And whilst we might be changing some of those communications, say on our social media, other social media stories or press stories may not necessarily yet be using that type of different language. So we have that, and it is emergent, I would say. So I would think we've done the start that you're looking for. It's now over the next period of time when that becomes more familiar, and when we've had opportunities to work with other things. We were looking at working with Regen colleagues on the draft UK Prosperity Fund. We were looking at trying to create funding that was dedicated towards younger households, younger working households. So we will take those opportunistic times as well as try to push to try and answer the bits that you're raising, which is around the less, the lower earners and see if we can provide housing and work with RPs on that. So I hope that's helpful to just give a little bit of added context to what colleagues have already said.
I suppose the only other point probably was talking about the timing for the strategy. So it is a 5-year strategy, but we will in phase 4 be starting on that quite early. So the data that we get for the next strategy will be now. I'm conscious that when we did it, we were basing it off a lot of it off the census data that we had at the time, which actually was quite good timing because we had just had a census when we did it at that point.
A dashboard for it.
There is, yeah, we are going to get the performance monitoring on housing as part of this discussion this morning, before we go into that paper specifically. So we have one big discussion. So hold that point and let's come back when we've had that. I've got Andy, then I've got Robin, then I've got Carol. Andy.
Okay. Perhaps some officers could forgive.
Sorry, Andy, can you say who you are?
Sorry, Andy Skeets, West Walsham, three-legged cross. I beg your pardon. Forgive my naivety, but I don't understand the complete structure of Dorset. I understand bits of it, but not all of it. But what I do understand is that a strategy needs to meet the needs of the council, the partners in that council, which are the parishes, towns, and every conurbation that we have, and very much the people of those places that elect us into a position where we can scrutinise what we're doing. So on Alex's point, on a PRP, I think it's called it, where there is a definitive rule that we thought we'd set that allowed us to use a piece of land that we may not have developed other than for helping the local community, that then, because of our strategy and because of our rules and all the regulations that are linked with it, means that somebody very cleverly comes along with a back door and slides something in there which puts that policy into somewhat lack of effectiveness, because once you've opened that door, we all know what developers do in the future. So we have in terms of the World Cup, we have an open goal without a goalkeeper, don't we, really? And I don't think that we can allow the strategy to go through without addressing that. And I'm really surprised that you had your other board thinking 50-50 on this, because I can't really understand why 50-50. You can probably explain that to me, but I do think it's very important that we actually act upon it and do something quickly, not wait for 18 months or so while all of those properties that we've allowed to be built are then turned into something that we don't want. If we don't act straight away and quickly and decisively, we're left with giving that up, basically giving it away to a way of use that we didn't envisage in the first place. So I think we do need something. We do need to do something, and we need to do something quickly, because if we don't do it quickly, we lose the impetus of what we've planned to do.
Are you talking about viability?
No, I'm not talking about viability. I'm talking. Yeah, thank you. Yeah, that's a better way of putting it.
Jill,
Yeah.
to respond.
Jill?
Sorry, yes, I really would like to respond on the principal residency policy work. First of all, the policy, the document that you've got before you today covering that is still in draft. It's not complete, and we've put it in as it's part of the ongoing work. But what that paper is a research piece of paper, a research piece of work. And this is basically what the research has found us. A lot of the problems with principal residences is that the inspectors don't approve them, And just looking down on some of the neighbourhood plans, they weren't approved for Bridport, wasn't approved for Weymouth, wasn't approved for Portland, Charmouth wasn't approved, Chesil Bank did get a principal residency within their neighbourhood plan, as did Swanage. Now, Swanage, I believe, is under development. This is their neighbourhood plans. Swanage is under development at the moment. And looking at the percentages, I think the inspector may well be minded to approve that to have principal residency policies within it. So I think what came out in the paper, which is in the paper before you today, is that the best way of doing principal residencies is through neighbourhood plans because of the weight they will carry. What that then leaves us is the position that Councillor Brenton mentioned, where we don't have neighbourhood plans. So I think my personal view is the best way to look at that is if we can look at it through the rural exception policies that we put in place. Because at the moment we've got, I think it's a 30% rural exception in the draft local plan. If we put restrictions within that and put the principal residencies within that, I don't know whether that would be accepted by the inspector. I'm not a planner, I know very little about planning, but I think there's a lot of ways we can do this without actually having a principal residency policy that will not go through the inspector as it stands. As I said, this is a piece of work that is ongoing at the moment. The paper you have before you today is the research work from it. And the interesting thing for me was that, okay, we can put restrictions on new builds, but we've got absolutely no say on existing houses. So if somebody wanted a second home down here and wanted to buy one, basically, they probably won't buy a new one. They'll just go in and buy a house on the housing market. And there's no way we've got any controls over that. So I think it's almost shutting the door after the horse is bolted. And I think people are wedded to principal residency policies because they're not fully understanding what they are. They're thinking, I think a lot of people think that we can put restrictions on existing houses. We can't. And I think we've got to be very, very careful what we do with new builds because we have to make our estates, our new builds viable for local people. Thank you.
Very much.
No, it doesn't really answer my question, I don't think, but I'm keen to make sure that we just don't let this roll away because if we keep deferring it or looking at other ways of controlling it, like did you say a rural exception policy or whatever, then we still have to meet the requirements of the NPPF and all the requirements of planning, and we get absolutely hammered then by that side because the structure is so strong. So forgive me, Jill, a wishy-washy approach or a
no,
sort of like pushing it to a fore is not what I think we should be doing. I think we should somehow bring this forward, but I don't know the structure well enough to suggest how that happens. But I do think that we should be addressing it.
If with your indulgence, Chair, if I could just answer that. These are planning policies that are enshrined in legislation. We can say from here whatever we want, but the problem is that they have to feed in through the local plan, which you'll see there's a paper on Cabinet next week about that and the timeline for that. What I wanted to do with doing this principal residency investigation within the housing strategy is so we can feed into it what we want. What I want is a strong voice from housing within the local development plan, and this is part of that work. So it's not brushing it under the counter at all, trying to get rid of it, saying, yeah, we don't want it, it's Dorset Council's policy. It's not Dorset Council policy, but it has to be evidence-led. It has to be something that the inspector will approve. Otherwise, he'll just chuck it out. I hate to say it, as an elected member, it's not down to us, it's down to the inspector at the end of the day. Thank you.
I think the problem that we've got is that I've already had one question raised. Why are we getting a research paper to scrutiny? Because that should be going to overview, because it's new development. Our role of scrutiny is to look back at what's happened and how effective it's being. And I'm very, very clear on our remit on that. And also we are straying into the work of place with planning policy, which, as we've said, you know, housing is involved in everything and it's really integrated. So I think on some of these aspects, it might be worth having a chat with the chairman of the other scrutiny committee about holding a joint meeting where we can then open up a lot of these knotty issues that cut right across the work of both committees. Because I mean, I know 4 of us on here. 1, 2, 3 of us I know sit on planning committees. So we are aware of the importance of viability and these issues that Alex has raised. So if members are in agreement, I will, in the summing up again, perhaps look at see where we can take this further. But I think it needs to be joint, and I think we need to be very clear as representative members what is new development or new ideas coming forward, which is what Joe's been talking about with this research paper. Because that is looking towards the future and the new local plan rather than what's here. So I'm not to suggest that we scrutinise that part of the report today. I think that needs to be done somewhere else, and I would suggest you take that to overview to feed into the new local plan. And then that will fit in a lot better than the work that we're doing. I'm going to move us on. Robin, you've been very, very patient. Good morning.
Thank you very much. Robin Legg, Sherborne Rural. Just to understand some of the detail about the number of affordable houses, 423. Those are a combination of rentals and freeholds, whether they're shared ownership or some other fancy form of transition from leasehold to freehold. 423 with a target of, I found several references, one to a target of 450 and one to a target of 500. Those presumably are all delivered under Section 106 agreements, or predominantly under Section 106 agreements. We have a housing target which has been expanded almost to double what it was in terms of the delivery of housing within Dorset. Under that new higher target, presumably the target would move from 500 to something like 1,000 houses, wouldn't it, of affordable homes? I'm just trying to understand what 423 represents in relation to the delivery of general housing within Dorset within the last 12 months. And to note the fact that in terms of social rented properties, that's only 6% or so of the 423. It's 20, is it 28 or 29 social rented houses within that 423 figure?
Yeah, thank you. Paul Darren, Housing Enabling and Delivery Manager. Yeah, 28 social rented houses in that mix, which fully accept is not a high number. Previously, though, for a long time, because we have to work in government frameworks, we were delivering none, and that number is looking like it will increase. Those homes are delivered partly through Section 106 agreements, which is where open market develops at a portion of affordable housing. There's also quite a lot of grant-led schemes that Homes England funded. So it's probably about half and half without going into the figures in a lot of detail. And these are often on schemes, development support for all affordable housing by housing associations like Astor, Abri and Magna. So it is a more mixed picture. 423 was against a target of 450. It was a disappointing end of year. I think in part it was the impact of nutrient neutrality. Admittedly, it's taken a couple of years to build up, but where no planning permissions were issued for a couple of years, a few sites got significantly delayed or sadly were no longer being brought forward for affordable housing. And also the weather in January and February, if you can remember, rain, when it was really all of the sites essentially came to a standstill in the winter. So it was a disappointing end to the year. The figures we forecast are to go up incrementally each year, because I absolutely take on board Councillor Legg's point that our targets are going to go up. I don't think it will be immediately reaching those new targets, and they will take a while. So we're anticipating the targets to increase by 50 homes a year to be realistic but still challenging. It's an interesting housing market at the moment. We've definitely seen a slowdown. However, from an affordable housing point of view, that will lead to opportunities. So we've got some big schemes coming forward, like a little more Beers Farm at Bridport, where additional affordable housing will be delivered outside of the 106. So we'll have the 106, but grant will be used to bring forward additional units because, in all honesty, it's slow to sell the open market. If you're a developer, you get a guaranteed return, it's risk-free. So the numbers are looking okay in that regard. There's also a new 10-year affordable homes programme from the government that we've seen the details. What we're waiting for is how many homes we deliver through strategic partnerships, which is with the bigger RPs. So we'll know those targets September, October time. And again, that will lead to more all affordable sites. The example that jumps to mind is there's the 4 Paddock site. You might have seen some press releases in Dorchester, 108 units, will be all affordable through grant funding. We'll go through planning as a traditional open market site, but the market homes will be switched to all affordable. There's some sites around Marlin and Sturmis, I think, Cal, you might have seen as well, becoming a more common approach. And these will be a mix. Most of the ones coming forward are a mix of social rented and shared ownership housing. Again, we need to be careful with the balance, make sure we've got sustainable developments. We don't want building long-term problems. So I think we are fairly confident, although 400 was a disappointing number, that the pipeline does look relatively positive, despite uncertain times.
Could I, Chair, briefly follow up with a theme which I started developing at the council meeting on Thursday, and that's the change of Prime Minister. We're going to have a new Prime Minister in about an hour's time. I just wonder how we will react to that, bearing in mind the statements that have been filtering out about his determination to build more social rented housing.
I can just comment on that again. I mean, hopefully he'll build on what's in the existing policy, because the grant funded schemes are all about social rent. Clearly, our planning policies aren't asking for social rent at the moment. That might change in the future. I suspect and hopeful that he will build on what's already in place, maybe with a bit more ambition. And yeah, setting good targets for the RPs to clearly build most of the homes.
If only we all had
Okay. If you'll excuse me, Chair, I've got to go and fetch the dog from the dog groomers now. It's only in the same village. My phone has just gone ping, so it's the reason I'm not with you this morning.
Picture later.
Okay. Thank you very much. Okay.
Yeah.
There's always a risk that I will be edging over into planning, so haul me back.
I have that risk as well, don't worry.
It's very difficult for us, for you, to come up with solutions when there's and plans for the future to help our residents when control is in somebody else's hands. And specifically, I am interested to know how many of the Section 106 affordable homes that are agreed through planning subsequently leak back out of the system again with planning adjustments.
I mean, I can't quote you the numbers off the top of my head. The majority get delivered. I know, and we do get challenges, and we are seeing that as an increase because of the challenging market. But the vast majority do get delivered. The vast majority of developers on big systems want to deliver some affordable housing because it suits their business model. They can sell them off plan. They can find quite a bit of the infrastructure, and I think, not all of them, but the majority do get delivered.
Can we get those
I'm
numbers?
going to challenge that because up until 2 years ago, I chaired the Eastern Area Planning Committee, and I think we've got 2 other members of that committee here as well, and we have seen an increase in developers coming back on viability to have their affordable housing contribution removed.
Yeah,
we've had developers come back. One was a development in Burwood with, I won't name the developer, where they couldn't persuade an RP to take on the affordable housing provision and therefore wanted to change the scheme into one of these helping purchase
Yes.
ways of providing, because they couldn't get an RP to take it on as affordable for rent. So what worries me is that all the government policy is aligned at pushing councils to get the planning consents out, and so that we can get on and build. In our experience, the difficulty lies within the open market, because developers will not build if they're not going to make a profit.
And just like, so,
And I can, sorry, before I'll let you come back in. And I can see that with the way that one of my sons is an estate agent, so I get my ear bent on a regular basis about what the housing market's doing. And he's telling me that the housing market is flatlining. So you've got these increasing targets. Yes, there may be some windfalls, but I have to say, I want to put it on record that I am concerned. I do not think that given all those variables, unless Andy Burnham can pull a rabbit out the hat, that we are not going to get anywhere near those targets in the next coming years, because viability is the one thing that all the developers are starting to use. And because it is at the bottom of the list of things that we can do through a Section 106, all the environmental stuff comes first. And if a developer then says the project is not viable, the first thing to go is the affordable housing, and that's what needs to change. It needs to have a higher priority than some of these other things that we have to put in, which perhaps aren't the greatest need now. We've got signs here, there, and everywhere. Do we need all these environmental protections to the level that we've got if we can't provide the housing that people need? That's a question for another place, so don't please try and answer that. That's the bee in my bonnet.
yeah, just want to cover, I do know it does happen, Bob, and I know that you get more challenges in the eastern area as well. And I think because that's your high value area, a lot of our affordable housing is in the other area. So I know there are particular challenges. There were particular issues on the estate you've mentioned. There is also a limited appetite with RPs to pick up Section 106 homes. They'd rather do the all affordable schemes that I've referenced earlier. So there are challenges, and also they're being a bit more picky. So if they're not meeting the standards they want, they can choose elsewhere. Why are we building? Why are we allowing things to be built that aren't going to be picked up? Well, surely that's a minimum standard. Sorry, Chair.
Yeah, there is a decent home standard. Wait, I'll let Paul finish.
So I'm losing my train of thought, sorry, a little bit as well. So I'll let Ian come in. He might come in.
Well,
Go for it, Ian.
I think new house building is a complex area. It's a profound thing to say, but it's incredibly complex and there's a lot of moving parts. So the market in Dorset is flatlining, there's no question about it. And you've also got other pressures on housing associations who are our principal partners here, because you've got AWAB's law and you've got the regulator really pushing really hard in terms of investment in existing housing association stock.
Yeah.
So some associations are saying, well, we've really got to invest in what we've got to get that up to a better standard. And this Section 106, not quite what we want, so we perhaps aren't going to go for that. But the bottom line in here is that the RPs are land-led developers. They're having to go out and partner, buy their own land and come forward with schemes. Now, this was part of the discussion that we're having in terms of, well, what does the council own?
Yeah.
What land does the council or assets the council currently own, which could then be brought into play for the housing? And part of the reason I think why the strategic development framework is a little bit delayed is actually going through the first phase of the asset review on current assets which are not being utilised. So we've identified some sites there that the council own, and we can take that to market. We can not only just take it to market, but we can actually determine what's going to be on that, because we've got a significant shortage of smaller properties, smaller accessible properties, and certainly your 4 and 5 beds, absolute dearth of that. So the control that we can exercise as a council over our own land is really important. But before we all get our hopes up, there isn't a huge amount of land that we can actually do it with. And I suppose the issue is going to be, well, what does the council own, which may not be fully utilised at the moment, which could be put into the pot in terms of potential development sites going forward. I wouldn't take that one any further, but we have to kind of look at our own kind of position here. And of course, we've got the increased numbers we expect to come through from the new Prime Minister, new social housing, but there's a lot of moving parts here that we've got to kind of get our heads around, and we are subject to market conditions and market flows. I mean, if somebody, as you know, somebody who's new coming down here thinking, my God, this must be an absolute prime location and we're going to get all these new developments, but flatlining market situation is quite a significant factor. But I think if we, you know, if we can have some potentially difficult conversations going forward, then we may be able to increase the numbers that the council can provide. But we are land-led by the RPs, and because they are principal partners in this. I hope I haven't waffled on too long there, but you know, I just wanted to kind of add that in whether Paul's got his train of
Just
thoughts
wanted to
back.
come in, I think, at that point.
Yeah, thank you. Jess Maskery, Head of Assets and Property. So just to build a little bit on what Ian was saying there, the Strategic Asset Management Plan, the Council Strategic Asset Management Plan absolutely recognises the priority around housing. So it's aligned to the Council's 4 priorities. Ian mentioned the asset review process. So to date, we've done asset reviews of 1/3 of the estate, and that's where we've been able to bring forward the sites that Ian mentioned. The asset review process is a continuing one, so we're constantly reviewing all of our assets, and the next sort of rounds of asset reviews will get us into some of those operational buildings where there'll be some challenging conversations to be had about use of those buildings and effective use of those buildings. But we do envisage that that will potentially free up more assets for repurposing. So that will then feed into the work that we're doing together. So that initial review has provided some, but it's an ongoing process.
Right, I'm going to move on. Oh, you've been patient.
Carol Jones, Sturminster Newton. Actually, I remember from our most recent planning meeting that we had, Wyatt Holmes said that the cost just for viability was running out at 78,000 per property. I mean, you can see why house prices are I mean, it's just ridiculous if you put that as a percentage against the average house price. Anyway, right. Under accessible housing, housing for older and disabled people. I mean, I'm just wondering how we, in planning committees, can actually insist on a percentage of the affordable housing or to be disabled friendly, you know, perhaps with a wet room or something like that, because I know that when we've sat in planning meetings and we talk about, well, what's going to be accessible, it's not something we can actually stipulate. And I'm just wondering where that might come within a local plan. And under building regulations, M4 2 in brackets, I just wonder how we can make that the norm as stipulate that should be the norm.
That's straying out of our reach.
I know, but yeah, but it's in that we're talking about influencing our local plan. But is there anything, as we don't quite know when our local plan will be signed, sealed, and delivered? So, is there anything you feel we can do before then, in terms of accessibility, to help that situation?
I mean, it's very difficult. It is having the right planning policies. I think it's probably the answer. I think probably on sites that we own, we could be a bit more ambitious, perhaps. And certainly most of the RPs and the affordable ones are trying to move in that direction. And a lot of them have slightly higher standards that the market house builders are aware of their likely occupants. So there's some bits around the edges. I think the principal thing would need to be a local plan policy, though.
Yeah, but we are trying to influence that.
We are lobbying that. And also, just to clarify, we do have lots of meetings with planning about their local plan. We don't sit outside of that. I am in meetings with them all the time talking about these issues and affordable housing issues.
Okay. And I know
Sorry,
when we were talking about the language changes earlier, I don't think it's just what is affordable, but I think actually what would sit really well with residents when they're, oh, not another planning application for 100 more houses and all of this. But if we can demonstrate that they're going to local people, because I don't think that's ever followed through in comms, but I think that would really help to actually demonstrate that. In terms of identifying the data, I'm trying to actually understand how that actually, I understand in a way why we perhaps should have some data to identify housing need, but when we have targets stipulated that we have to meet, how can we use our own data to say, well, perhaps that's too many houses? I mean, I'm just wondering what the point of data is when we have everything thrown at us that we actually have to meet.
I mean, I think just on, so I know it was on the housing needs and on our look at from an enabling team's point of view, it's brilliant so we can try and match the local need with the local areas. So you're right, we have these overarching targets, but we can look at actually in Dorchester, for example, there's a particular need for 1-bedroom properties, 4 bedrooms. We can use that to hopefully influence if the larger sites in Dorchester come forward. These are needs. So it's really useful for us to say we've got this identified need. We know on the housing register there's 20 real families that need 5-bedroom property. So that's a use for us. Then you're right, you've got the overarching target.
Okay, so that's going to be done by area.
Yeah.
Okay, thank you.
Sorry, Ian, do you want to?
I wonder if I
You're
could
right,
just,
sorry, I'm going through my list.
No, if I could just wind the clock back, sorry, about 3 minutes ago when we talked about what can we do to try and increase the supply of the stuff that we need. I mean, Paul will maybe kick me under the table. That's why I'm sitting up here.
Fair play.
But, you know, there may be things that we could do even with the viability stuff, because there may be some funding in Section 106 funding. There may be other funding elsewhere we could bring to bear to kind of maybe even pay the difference, or, you know, I say pay the difference, you know what I mean? But, you know, a housing association could be attracted to a scheme where, yeah, well, okay, we'll provide a 5-bed, or we will get more accessibility. And I think that's something that we need to think about in terms of how we could make certain schemes work better going forward. So that's very embryonic at this stage, but I think it's certainly worth looking at to take that forward.
That sounds as though you're suggesting that with a little bit of help, the RPs could offer to pay more for the housing, which would then ease the viability argument for the developer. That to me is a very dangerous route to go down.
No, we're looking, I don't think we're saying that specifically. What we're saying is there may be options available that we should look at, cost them out, look at the cost benefit analysis to see what we need and what we get. So it's early days in terms of thinking, but I don't think we should put anything off the table in terms, you know, I think every member around the table will know that 5-bed properties are like chicken's teeth. Is that the right term?
Hen's teeth.
Hen's teeth. I'm Scottish. I'm Scottish. What do you expect? So there may be just things that we can put into the basket and just work through that.
Do you mind if I just drop in on the data just quickly?
Yeah.
One of the things that when we were developing the strategy in the first place, that we realised that there's lots of pockets of data throughout council. It's not speaking to each other. And so there would be situations where somebody from adults would come and knock on Housing Store and say, we need this property right now. But had we had access to that data and had we been able to do some modelling, we would have been ready for it and being able to prepare for it. So it's about knowing what's coming that could then influence some planning decisions. Being able to talk to our developers and the RPs and saying, we know that this is a specific need for a particular family. They're going to have that need in, 5, 4, 6, 7 years. And also having that real clear information, talking about sort of versatile adulthood, of knowing who's coming through that pathway, when they're coming through, and what specific needs they might have, so that we're better able to support. So it's data that really informs across the decisions across the council for our residents' needs, whatever those needs are. And one of the things that we've talked about is being able to do some future projections on some modelling. And if we made this decision here, what would it look like in 5 years' time? And yeah, that's kind of that's really where we want to be with that data.
Thank you. My last one here is your downsizing initiative. I'm just wondering, what exactly is that? Is it working? Have we got it into play, and have we got any results through it?
So we were initially thinking that is there a way that we can better support our residents who want to downsize to downsize? We went out and we spoke to residents who wanted to downsize. So we're looking at social housing at this point, I should just say. We have that for owner occupiers in the next phase. We wanted to understand what the barriers were, and what they actually told us was they didn't want another system. What they wanted to understand was what their options were, what support that they could have. The barriers for most moving were cost. So it's about, for us, it fits in a little bit with the RP work that we're going to be doing in the next phase, about how we can encourage more funding for them to do it. So we thought we were going to be ending up doing something, but our residents told us they didn't necessarily want us to do it. They wanted us to support it through influencing our RPs and just getting them all to work the same, because they don't. And there is some work for us to do communicating options, because many of those that wanted to downsize that we spoke to didn't really understand that they could join the housing register and move that way. So there are pockets of communication work that we need to do, which will come out as part of this whole language change, and there'll be a campaign, but it's more about trying to influence our providers to do more to support their residents and to do it consistently.
Good, thank you.
Andy, you wanted to come back? Andy Skeets.
No, I think you was covered well.
Okay, I don't have any more speakers, so I've got one question. Particularly in the Purbeck area, there is a policy on second homes, and that the money that we get from the second homes council tax, which is charged at a full 100%, so they pay double the normal. My understanding was that income was to be used to support affordable housing. Can someone answer that question for me, please?
Yeah, there was a council decision to allocate 40% of the second home bonus to come to housing. We answered the question at full council, I think 2 or 3 councils ago, which identified how we'd spent that in the first year. And we're now looking at opportunities to continue that spend as we go forward.
Okay.
And some of the stuff I talked about, I'm not saying we're doing it, obviously, but you know, the viability stuff, the accessible housing, the TA, etc., etc. There's options that we need to explore in terms of where we can allocate that funding to.
Joe, you want to come in on this?
Yeah, it's thank you very much for allowing me to come in. It was just a thought, because we have these discussions regularly, and I'm wondering how I can get more information to members in this committee specifically. And I was having a conversation with Ian on Friday, actually, as to whether we could have a separate budget line, so it's obvious that this money is coming into us and how we're using it. So I think there's a conversation that we may need to have with finance, just to see if there's a way of doing it and whether it can be properly ring fenced, which I know ring fencing isn't done on this council for good reason.
What I am concerned about is that thank you very much for that, Jill. Ian, you said that only 40% of that second homes money is allocated to affordable housing. My understanding was that all of it was supposed to have come into affordable housing. So where's the rest of it gone?
I'm not sure, Chair, that's the corporate understanding of that. I think the figure that was given is that 40% year on year would come to housing, and the rest would be allocated to the general funds for wider council support.
Chris, any more on that? So, how do I sum all of this up? Okay, so we've been asked on the actual. Did I come in? Oh, go on, very quick.
All right, this is the
Very
last question. I won't take long. Under the when we were talking about asset-led sort of initiatives, and you're looking for a provider, could we not look at using our own setup with Dorset Homes at all? Or because I'm not sure that's ever really gone anywhere, and it could be the perfect vehicle.
There is actually a report on potential use of Dorset Home or Homes Dorset for wider initiatives, but we feel that's inextricably linked with the report that's coming on settled lease. So I think those two are very much intertwined, because you've got to have kind of critical mass and viability if that company was going to become a viable working company. So again, it's one of these situations where we're doing the due diligence on the potential for these two schemes to come together. But I'd have to say at this stage, these are very complex, high risk schemes, and we want to make sure before we go back to cabinet that we've got all the I's and T's, what will you do with them, but having them all in place. So I think at this stage, probably not for that, for what you've actually specifically talked about.
If I might just come in, I think I may have also confused it with the word provider.
Right.
So what we're looking at for these four developments, they're small developments. We've got one in Littlemore that's going to be specifically for adults. And then we've got one which is a fully adapted temporary accommodation. So that would be in-house. We've got one of them is for, I've forgotten the name of Ian's team. It's for people who are fleeing domestic abuse. And then the last one is for children's services. So these are across the council. And the provider that we're looking at is a social enterprise company who will come in to do all the groundwork to get those developed. But that's what they do. Then they hand off, and adults will be. I think they're working with a company. Is it? No, the DB is Paragon, is it? Or
yes, DB.
So there are different. They're being worked on in different ways. So children's services will manage theirs. They'll either be managed in house or with a provider, a specialist provider, depending on what their accommodation is going to be used for. Rather than to a registered provider. So I think I just slightly confused with the words. I just wanted to clarify.
Ian, when we had the chairman's briefing, we were going to bring in the performance monitoring at this point to do with housing. Had you had that discussion about when that was going to happen?
So I did have that seamless. As you can see us looking at each other over the shoulder, and this is seamless.
Yeah. I'd rather, while we're having, before I do the sum up and the recommendations, it's important that we have the performance data, just in case there's anything else, because when we do the performance data, I'm not going to have another full-on discussion about housing. We're having one discussion today. Yeah, just on this, and then we can perhaps when we do the voids paper, if we have the main officer presentation, then immediately you come and give us the performance data on the voids. Then members have got all the information they need to then ask the questions and have the debate.
I'll just ask Mike, who's online, to bring up the dashboard and we can talk. Thank you, Mike.
Yes.
Yeah,
Yes.
I'll give a brief overview of some of the indicators that are there. Mike will bring them up in a bit more detail, and please, Chris Highway, strategic performance, intelligence and risk, apologies. Please stop me at any point if you want to deep dive into any of the indicators. But starting with looking at net number of families in bed and breakfast, this is an improving position. Green rag status and direction of travel was reducing over that period of time, and a similar position for numbers of house fitting temporary accommodation. Some of this, of course, will come into report. Net number of single households in bed and breakfast, so an improving position with 56 at the end of Q4. We talked about the number of households, the number of affordable homes delivered as part of the previous debate there, and the number of approaches resulted in homelessness assessment, 185, which again is a rag of green and direction of travel of green. General picture here is of one of improving, performing ahead of target. And looking at duty to secure permanent accommodation, a rag of same and similar trajectory over the previous quarter. Happy to really look at any of those in detail. There are none that came up in the exception reporting, so happy to look at those in detail and see again questions. Moving on to the void report.
Members have any extra questions on? Okay, so before we move on to the voids, I'm going to do the, stay there. I'm going to do this summing up on the strategy so that we still, we keep things very clear. So, we talked a lot about planning and the local plan and assets and where all that goes. So if members are happy, I would like to make a recommendation that we look at having a joint meeting with place overview so that we can actually cross that divide and start to really unpick, because we've got planning expertise, not experts, expertise on here as well as on there. And I think by having that joint conversation, we might be able to have more influence on the emerging local plan. So if members are happy with that as the first recommendation. Also included in that discussion is talking about the primary residence policy and the conversation about rural exception policy, and also some of the discussions about accessibility, because we have got building regs, but I think what we're talking about is going further than that. So that needs to be part of the local plan discussions rather than here. And also the importance of housing colleagues being involved in the local plan discussions. I can't stress that. I think we all be very supportive that you have a really strong involvement in that. What else have we got here? I think the comments about working better with adult services, about advanced noticing for modelling the types of housing, I think as a committee we would endorse that.
Definitely.
So you have our backing for that, and if we have that set as part of the minutes and a recommendation, hopefully that will help us on its way. And I think we also have concern over meeting the housing targets because of where the general market is going. I think we need to highlight a health risk on those targets. Is there anything that people feel I should have picked up that I haven't picked up on my scribbled notes? So are you happy that we have looked at the housing strategy in detail? We've commented on its progress. I think we would like to see, sorry guys, see you back again in a year's time for another annual review. I think it's such an important policy and strategy. We would like to keep that monitoring going.
And I think annually is probably enough because you're involved in, I don't think anything shorter than that would give us any great gains.
Hopefully by then we'll know what,
And we'll know what's happening coming through for
we have
government.
lots of extra money for social housing or not.
Well, even if it changes where housing comes on the hierarchy in planning, that would make a huge difference. But we wait to see what his first 100 days in office.
We can't have any influence over the viability amounts that builders are having to, because it's really affecting everything but housing.
But that goes through the district auditor. Sorry, the district valuer. So, and that's not our remit within here. We look at.
But we can see it's a problem.
Yeah. So we could certainly add viability to that joint discussion with place, and I think that's a better way to have it. We're pushing our remit by having that discussion here.
Okay.
It's not really. So with all of that and the review in a year's time, our members happy to agree those recommendations. Yeah. Thank you very much. How many time? It's 12. I'm going to move on to the housing voids. And then depending on how long that paper takes, we might take a short break at that point. So, who is, Jess, you taking us through the voids? If you'd like to.
Thank you.
Demonstrate it.
Thank you. So just a reminder, Jess Maskery, Head of Asset and Property. Firstly, want to really emphasise that this is a joint report coming forward between Housing Colleagues and Assets and Property, following a request from this committee for further information on how the council manages its empty housing properties. The housing voids management process has been in place for some time, and as I said, relies on joint working between housing and assets and property. Bringing properties back into use as quickly and as efficiently as we possibly can requires coordination across the two services, because we both have responsibility for different elements of the process. Going through from the point at which a property becomes void all the way through to the reletting. The process is kept under constant review, and we're constantly tweaking it to make improvements. There's some work ongoing to better understand the costs associated with it and to identify further opportunities to reduce turnaround times while maintaining the required standards of safety. The detail is set out in the report, so rather than repeat that information here, Ian, myself and colleagues are very happy to take hopefully that.
So seamlessly, I'm going to move across to Chris to give us the performance data on voids, and then that should set members up, having read the report, on any questions they might have.
Michael, bring the dashboard up very shortly for us. Just while we're waiting for that, as I said, the net number of families in bed and breakfast at the end of the month was 10. Which was green rating, directed travel improvements. There's an improving position there. Bring up the trend shortly for you if you look for that. And the net number of households in temporary accommodation was 202, looking at the March 2026 figures. Just again, rag of amber, but an improving position. And the single households in bed and breakfast, which was one of the performance indicators that drove this interest to bring this paper forward, was 56 at the end of the quarter. The rag of amber and an improving position from there as well. Those are the three indicators that are relevant to the discussion.
If you won't see the dashboard.
Check. I think he's bringing up.
That's okay. I think the fact that you mentioned it is a great help. So, members, over to you.
Carol? Can I just ask, are we only looking at voids for temporary accommodation? Can we ever expand voids to include all accommodation through registered providers? Because I know that, there are homes sometimes, I've seen them sitting empty for 5 months when we've got people on the housing list desperate to get in. And I just think to me, that's the biggest problem. Am I speaking out of turn?
We do have a programme coming, which is looking to get all of that data from our RPs and have it in a consistent way. I don't think we can report on it other than what they tell us and what they publish themselves. But
Yeah, it's not really something, I mean, these are independent organisations, and although we meet with them quarterly, they do go through their KPIs with us. Housing associations do not like to have voids. You know, they work really hard to deal with them, but there'll always be the exception. And I suppose I can speak because I've been on both sides of the fence. We would normally pick that up as part of a regular discussion with them. And so far, I'm not really picking up any specific issues that they've raised. Although, as I say, there'll always be the occasional one, but we can't directly influence that other than make sure we get the nominations as quickly as we can over to them, which again, I think on top of that, there's no particular issues there.
Okay, right, no, thank you.
I think it emphasises the need of having good working relationships with all of our outside partners, whether it's housing providers, whether it's the NHS, whoever. We need to have those relationships.
Well, I've got two questions. First one, just prompted by what you just said there. If not us, who oversees registered providers to ensure that we're getting value for money?
The regulator for social housing is the regulator for all RPs. And all RPs get a classification based on viability, customer standards, governance, etc. And there is an inspection regime where every so many years, every association is inspected. But also RPs undertake a return mechanism. They report every year to the regulator. And of course, you've got the housing ombudsman, etc. I think the housing regulator has really got a bit more teeth in the last couple of years, in terms, certainly the issues on, you know, dampness and mold has brought that very much into perspective, and the consumer standard is really quite up there in terms of making sure that RPs are adhering to the required standard of service. So it's a regulator for social housing.
Sure, there's a whole bunch of other questions on that subject I would love to dig into, but possibly not today.
Not today.
This
is about voids.
Yes, so the real question, the one I wanted to ask, I mean, suppose full occupancy is a bit like full employment. It's a phrase that doesn't actually exist. There is never going to be a period of time. So I am interested to know what is the precise number that you aim to complete that allows you to have sufficient properties available immediately or going through the process, and how far away are we from achieving that? And the corollary to that is, you quote in the papers, what is it, £5,800 for a void cost. That's cost of doing business in the private sector. You're not afraid of spending money in order to make money. That's a cost of having those properties in place. What is the optimal amount of money that you would be looking to spend in order to have those? So rather than 5,800, you're looking to narrow the speed, or increase the speed at which properties can be turned around. You're looking to, lower the costs of the service, of the product you need in order to do the work. You're looking to increase the efficiency of the money that you're spending. What's the optimal amount of money that you're looking to spend in order to achieve that? So how far away are we from actually being a perfectly operating, perfectly functional department?
So the amount varies across the different categories of voids, as you would expect. I think that and we need to do further work together across assets and property and housing to fully understand what the optimal cost would be. we are using we have a contractor in place for the voids repairs and maintenance work currently.
6-year contract.
No, so we have an interim who is in place until the long-term contractor is in place. That long-term one will be the 4+1+1.
Yeah.
We expect that to deliver better value because it's a longer contract, and it's we will spend time through the procurement ensuring that we're getting the correct the best value from that contract. But I don't think we're far away from what we would expect to pay to turn these properties around in the period that we are trying to turn them around. So the number of days is much quicker for a minor than it is for a major, as you would expect. The numbers that sit in the exceptional category should be fairly low because we shouldn't see too many exceptional properties coming through. The very nature of those is that it's very difficult to predict how long they will take and what the cost will be.
I think if I could just add to that, you've also got the other kind of cogs in the machine in terms of quicker we can turn things around, then you're not losing rental. So that you've got that, and you're not using B&Bs.
Yep.
So the quicker we turn these things around, and we do get relatively high turnover because it's temporary accommodation, but it's keeping that void period to the absolute minimum as much as we can. I think building on that, again, a joint piece of work, we are about to undertake a stock condition survey. So all our TA is going to be surveyed and inspected, which will allow us to take decisions on potential disposal of the ones that are just not really up to standard, but also investment requirements and long-term retention requirements. And add to that, we're very much advanced in looking at a potential onboarding of a temporary accommodation leasing scheme. So we can actually increase the numbers of TA and again have the beneficial effect of reducing use of B&B. So there's a lot of kind of moving parts that we want to get right.
We do. What are your timescales on that work?
The leasing scheme, we're quite well advanced on that. We're going through due diligence at the moment, and we're looking through the financial model to make sure that the risks are absolutely crystal clear and that there are mitigations that we can put in place in respect to that. We have cabinet approval to go ahead with it, pending all those legal, financial, due diligence checks. But with a fair wind and overcoming the problems, then we're looking to start that onboarding later this year.
And what about the condition survey?
Condition surveys it will be out to the marketplace imminently as we speak. And we're expecting tenders to come back middle of August to the end of August. And hopefully the whole stock condition survey can be done and dusted by the end of this year.
Wants to come back.
It's all really interesting. Thank you. One question, disposals are going to be politically difficult. It's a conversation that I'm sure is being had and has been had. Where are we with regard to ring fencing money comes from, or they're not our properties, but ensuring that it is reinvested in properties within the same area that they are taken out of. So you don't sell things that are hard to maintain in ultra rural areas and they put the money into East, for example. It's about maintaining property stocks where they are. Is that in place? Is that something that we can look at?
Not yet. It's not yet in place because the determining factor about disposal will be based on the stock condition survey. So only those properties that are beyond their useful economic life would be considered for disposal. So in terms of the recycling of the money, it's up to me to keep really friendly with our assets and property colleagues to make sure that that money is recycled into where it needs to be.
May I just
I wouldn't imagine these would be any of the said properties, but objectively, if they were any of the owned temporary accommodation, some of those have had specific grant conditions attached to them for the funding. And so they would need to, any funds would need to come back to that and then be reinvested in the same thing. So there may be any of that. We're very aware of all of that. I shouldn't think there are any of these.
And some, of course, won't be ours, will they? Because we'll be looking at the private sector lease.
Yeah, we'll look at them all. Yeah.
Do you want to do something as well? Yeah, just to just clarify that it would need to come through a governance process within the council, and that's one of the ways that you can look to say, if we're disposing of X, we would look to potentially reinvest in Y, and that would go through the capital strategy and asset management route. So that's an approach that could be taken.
And again, that would come from this committee, that would go through a different stream. Ben, welcome back.
Go clean now.
Is there anybody there?
Robin, have you got your dog?
Dog.
I've got the dog. The dog's returned, and so have the cats, actually. So I'm trying to fend them off. Is it my turn?
Yes, please.
Right, Robin Legg, Sherborne Rural. I was looking at pages 423 and 424, where there's a kind of a dot diagram of voids, and I was trying to work out how many how many properties we use for accommodation, and trying to understand what sort of proportion, which looks like about 20 a month, which become void. And I guess some of them are freeholds and some of them are maybe leaseholds, which we've taken on to provide temporary accommodation. And I just really wanted to understand what specifically was happening there in terms of the turnover. I mean, presumably, if we're moving people from temporary accommodation into longer term accommodation, perhaps with a housing association, we get quite a lot of turnover. And maybe we have, compared with a private landlord, we would have rather more regular void properties. Is that the case?
Yes.
Yes. Yes.
And you agree?
Think about collaboration and action. Yes.
So how many properties have we got altogether? I'm just trying to understand how many from that table. It wasn't entirely clear.
I think your best estimate is about 202.
That's a fairly precise. That's a fairly precise number, isn't it? 202.
It's approximately around about 202. So it's just over the 200 mark.
Okay.
But not over 203.
Perhaps during a year's time when we come back, we'll have the exact number.
Okay. And you were talking about engaging a contractor over did you say 4 + 1 + 1? Who exactly is preparing the contract for this contractor? Is it something which is done in-house? Is it something within our own legal team? Who's writing the contract and making sure that we get a contract which is suitable?
So there's a cross-organisational group working on the procurement, including colleagues from assets and property, housing and other parts of the council. The contract itself will be written by our legal services colleagues with input from the relevant stakeholders.
Okay, so if in a few years' time we find that there are some things in the contract which we don't think are quite suitable, we focus on the legal department. I speak as a sort of former lawyer in a local authority, that's all.
We would be instructing legal, so we would have, we would.
Yeah, I think the key thing is that all our policies are fit for purpose and need to be regularly reviewed to make sure that they still are, so that we can make the necessary changes as we move forward.
Okay, thank you very much.
Okay, Carol.
Just a quick question. When it comes to major and exceptional voids, what percentage of those are caused by tenant damage?
I have to give you an answer
Going-
outside of this
Well, I
meeting.
know
That for today.
but would you say that that is a problem?
I think with any temporary accommodation and with higher than average turnover, you're always going to get, how can I put it, more wear and tear.
Yeah.
But as to actual deliberate damage, I'm not aware that the number is high, but I will check that out for you.
I just wonder if there are any repercussions to people that are expecting us to go on and house them more permanently when they're causing such a problem in a temporary situation. And
There are checks.
our taxpayer has to
But I
fund
can
that.
come back to you on that
Yeah.
one. Yeah.
It might help to mention that the number of in each category, there's significantly more in the minor category
Right.
than major and exceptional.
Okay.
Richard,
Sorry,
sorry.
Richard Biggs, Cabinet Member for Regeneration, Economic Growth and Strategic Assets. So just to help Scrutiny understand, I think the effort that some of the background, I can say that there's an awful lot of effort that has gone on between Housing Asset and colleagues to really delve into this and to have a regular standing agenda item for this very thing of void management. There isn't a standing army of surveyors that do work this way. Often, it's got to go out to tender every time there's a review or something like that. It can't be done in house, which is frustrating. But that is a cost that we cannot bear. But I think an awful lot of work has gone into this, and I'm seeing improvements. Current figure is actually lower for this month in terms of void numbers. We're getting the responsibility of assets, and I think there was an issue of trying to understand where the problem lay. And it's not trying to blame anyone. A better understanding of who's the hold of that issue to move it along the line. So I think I'm seeing a trajectory which is going in the right way, if that's helpful to Scrutiny. But so as you are digging well into it, and I prefer to say there are issues from time to time. And lots of talks about the cost. That was a maximum cost you referred to. The average I think is 3,450, and so it is variable, and those are for multiple reasons. The quality of the accommodation, what those tenants have done, and those are often, being honest, tenants who are struggling with mental health issues, all the other things which may lead to, perhaps not the same care that you and I might have in the property, but that's not for here. But I think we all understand that, don't we? It's challenging sector. So that's all. But happy to answer any questions on this.
Carl.
Thank you, Carl Wood, Gillingham Ward. Sorry, it's a bit of a simplistic question, I think. What, in terms of the turnaround time, compared to other local authorities, are we actually kind of average? Are we higher end of the scale, lower end of the scale? And in terms of cutting down that turnaround time, what realistically would you think is a realistic minimum, let's say, turnaround time?
So the targets that we have for turnaround are broadly in line with what you would see in other local authorities. Obviously, it varies depending on the local authority and the style of construction and the demand, but we're broadly in line with those. I think we have brought, as we've worked together on that, improving the process, we've brought those targets down. As part of recent restructuring assets and property, I brought in a repairs and maintenance surveyor who specifically focuses on housing property, so not just temporary accommodation, but housing properties in general. So Having said all that, there are always improvements and tweaks to be made. And I think as part of the procurement of the new repairs and maintenance long-term solution, we'll scrutinise those turnaround times in great detail. But we're broadly in line with what would be expected.
Sally. Councillor Sally Holland, Chelsea Bank Board. With the renters' rights coming in and everything, obviously that might have had an impact on the time it takes to turn over of your voids, etc. But are you hoping in the longer term, once things are kind of up to that standard, then actually the times that should have impact on your timescale and bring that right down?
Yeah. Because we're actually the landlords of these, so it's a count. Well, most of the ones that we own, clearly we're the landlords, so we don't envisage renters' rights having any impact on stuff that we own. There's been no flow through yet to the landlords that currently we lease from, but that's quite contractual. So again, we're not anticipating a downturn in that. But these are things that, in terms of managing TA, that we really are, scrutinising exactly what the performance is, and if we can make tweaks in performance, we'll certainly do it.
And then in terms of the condition work, so the condition surveys that we're undertaking jointly, and the outcome of those in terms of potentially disposing of particularly poor condition assets and bringing new assets on, as we bring new assets on in through the onboarding, ensuring that we're working through the condition on those as well. That should, over time, improve the condition quality of the stock, and therefore should lead to more minors and less majors and exceptions.
So we were asked to review and consider the contents of the report and voids, and we've had the performance data as well. I think, if I've read the runes right, that we've had a good understanding of the work of the position we are currently, and the work that's been done since we asked for this report to come. And I think you're on a good journey. I also would suggest, perhaps, committee, that given that it is a journey, that maybe we'll still get the regular quarterly performance data, but when we just have a quick look, perhaps in 6 months, just to see how you're doing. Just a progress report. So it doesn't need to be a long paper, but just something, just so we can see that things are still moving forward. And then we're all doing our jobs. Members happy with that? Is there anything that you particularly want me to include in the recommendation? Fine, in that case, thank you very much. I hope you don't mind, Chris, but we are going to take just a 10-minute break. It's maximum of 10 minutes. We still have quite a bit on the agenda to do. And I would like to try and wrap it up. So we do get a lunch of some sort, even if it might be late. So 10 minutes. Thank you.
Sorry.
Order, order.
We were having a really good conversation there.
Welcome back, everybody. We're going to move on now to agenda item 10, which is the Q4 performance report, minus any housing data, because you've already done that, and I'm not going to
Not doing it.
So,
Thank you,
Chris,
Chair.
thank you. Over to you.
About housing committee. One thank the Highway Strategic Performance, Intelligence and Risk Lead. Presenting the Q4 performance report covering the period January to March 2026. This report forms part of the Council's regular assurance cycle and builds on the Q3 position reviewed by this committee on the 16th of April, which also provides an important year-end perspective on performance reporting. The data remains available through the publicly accessible Scrutiny dashboard, with this report providing an exceptions-based view of performance through Appendix 1, which summarises red-rated indicators, and Appendix 2, which highlights the amber indicators showing a worsening direction of travel. And across the services with the committee's remit, performance remains broadly positive. Of the 81 indicators reported, 40 are rated green and 59 are either stable or improving in terms of direction of travel. Before moving into the performance exceptions themselves, I'd like to just briefly draw members' attention to the risk section within the report. The dashboard incorporates strategic risks alongside performance information, recognising the important relationship between organisational risk and delivery of outcomes. Members may wish to note strategic risk 200 relating to health service reform and the potential impact on council responsibilities, service demand and resource pressures. This risk, together with the effectiveness of the mitigating controls, was considered by the Audit and Governance Committee on 29th of June. The committee noted the continued strength of the partnership approach being taken to manage the risk and maintain oversight of emerging developments. While the assurance on our risk management approach sits with that committee, consideration of how risks may impact service performance firmly, of course, remains remit of this committee. So before I move on to performance exceptions, I'm happy to pause and invite any questions members may have in relation to that risk.
Have any questions on them? It is a really important one that we keep monitoring because the financial impact of this authority could be huge, and that's why it's been taken on as such an important strategic risk. I think you noted the highlight, and we continue to keep a watching brief on that in the reports.
Thank you. Okay, turning to the performance indicators, I'll focus my remarks on the remaining performance indicators presented to this committee as we've already discussed the housing matters. Appendix 1 details the red-rated indicators and council plan measures supported by narrative context and improvement actions. And the indicators are rated permanent exclusions from schools, number of independent special schools, school places taken up by children and young people, percentage of 16 and 17-year-olds not in education, employment or training, rate of early health open cases at the end of and performance of deaths registered within 5 calendar days. I'll take the narrative as read as ever, if I may, and invite any questions on appendix at this point.
Hey, members, questions? While you think about it, I'll kick off. Obviously, that risk 200 was the key one that I marked, but there were 3 others that just piqued my interest. One was about the adult reviews and outstanding assessments. The other 2 were tribunals, because I see that there's been a blip in the number that we've lost on that. And I'm just wondering if we can have an idea of what the costs to the authority have been for those. And also, not so much one that I need a response from Children's Services on, but the Section 47 investigations, the RAG rating didn't appear to be quite coherent with the descriptor. So I wonder, Chris, if you could come back on that bit first, and then maybe on the other 2 issues.
Bring 7. It might be that I asked to defer to Paul on part of that. And I think the reality is the data is 84%, 83.95% against the target of 90%. So it's an amber and worsening indicator on that basis that it hasn't hit target. But there's some good narrative in terms of performance there, which it'd be better to defer to the subject matter experts to answer.
Paul, over to you then.
Hi, Paul Dempsey, Executive Director for Children's Services. Yeah, on that measure, the 84% performance is for March. The narrative does seem confusing. Now I've read it back and potentially a bit clumsy. It's talking also about performance in February of pretty strong, 97%. So it's the wrong direction of travel because it's got worse between February and March. If you take the performance over the whole quarter, which I think is a better, more reliable measure over 3 months, is 90.53%, which is just above our 90% target. And indeed, it is significantly higher than the performance over the whole of Q1, which was 82.47%. So over that quarter, we're fairly pleased with that performance. The national average on that measure for time and use of section 47 is 82.33%. So yeah, it blipped up really high in February, come down again over the more reliable, longer 3-month period. Performance was on target and strong, I think.
Well done.
Yeah, thank you.
Well done. Okay. So the other two, as I've got you in conversation, the tribunals and the costs to the local authority.
That's a good question. I don't know the exact cost. It's not, the actual performance wasn't much of a blip. Again, you're seeing it's got worse between February and March. Over the quarter, actually, if you measured from the beginning of the quarter, January, we had 14 tribunals in January, I think down to 10 end of March. So we're sort of up and down, but fairly stable. And I think that months that preceded that at the end of last year, we were sort of about 10 or 9 per month. It's always a balance where we go to tribunal. We don't want to waste money. There are lots of cases where we settle before that happens. We come to a different arrangement. We make a change decision, or a family changes their position, and we come to some kind of arrangement where everybody's happy. So you're only seeing a very small sort of number that get to those sort of tribunals as an end. And we know that this is an area of high spend. It needs.
Another one doing an update.
Some great news there.
So IT's doing wonderful things this morning.
I just stopped because I thought that.
Yeah.
Finished. So yeah, it's a balance. We're trying to get the right decisions for every single child. Sometimes there are challenges from parents about the professional assessments. We have to make professional assessments in light of our professionals' expertise in what they think is right for a child at that particular time. That's what we're doing, where we challenge the national processes for parents do have access to those tribunals. So yeah, but lots of families challenge us and they don't end up in tribunal because we work it through.
Okay. Oh, is there anything you wanted to add?
I don't think so, no.
I just thought I'd give you the opportunity.
Yeah,
I'll
I
give
mean,
you to all the other
it's a
governments.
conversation I've had with Carol outside the room in light of the reform plans and the ongoing impact of that, but this probably isn't the place to discuss that.
In that case, I'm going to come to Julia. The outstanding assessments and and reviews.
So this is an area that linked to our CQC inspection outcome is an area that is difficult for us at the moment to make the progress on we would want to. In Q4, the number of outstanding assessments was 879, which was a worsening performance on previous months. If you look at the number of assessments completed, we have more demand coming in than we're currently managing to complete, and that's both across what we call strength and needs assessments, so those are more generic Care Act assessments, and also occupational therapy assessments. Hence why we absolutely need to have that improvement plan in place, and why we've set those tight targets. It's a national picture which does not excuse the performance in Dorset, but it is a recognised national challenge, that increased demand in coming into adult social care. Not surprising in Dorset that we have an increase in demand given our demographics. We've talked about this quite a lot. It's an issue that we look at in the South West ADAS group, and we are hopeful that the new Prime Minister may prioritise adult social care and actually deliver some of the reforms that have been considered over some time. So we're monitoring it closely. As I said earlier, we've set specific targets to each team. We're undertaking much more analysis of the information we've got to understand which are teams that have demand coming in that they can't manage within their capacity, and which have teams who are not having the throughput that we would expect, so that we can take a specific targeted approach to each. And I'm happy to give a more detailed with some of the evidence of that to a future committee. That would be helpful.
When you talked about this before, excuse me if I've memories wires crossed, but did you not say that part of the impact of the waiting list was from COVID? And you had like a backlog that you were still dealing with?
So certainly COVID historically was problematic, but I would expect by now that COVID will be, I don't think we can continue to use COVID as an ongoing issue. There are certain cohorts of individuals where it has certainly caused longer program problems. So the number of people that we support with mental health support needs has doubled in the period since COVID. And I think that is an area where there is a legacy. Social isolation in people with learning disabilities, again, is a legacy issue. But the assessments themselves for people with LD, we would have likely have had to undertake anyway. So I think there are probably multiple reasons that vary across the different client groups we've got. Again, if you look at safeguarding, we've had a significant increase in the number of safeguarding referrals that have been made, and matching that demand within our current, our existing capacity is a challenge. The council helpfully agreed funding for 2 extra posts in our safeguarding service for this year's financial budget, so that we can address those real key areas of risk.
As regards reporting back, I think it's something that will probably come into your action plan, won't it?
Yes,
so
absolutely. I'll sit it
with that rather than bring it out separately.
Yeah, thank you.
I just asked Julia, with the although I know we're looking sort of at a much earlier stage here, but has your workload increased with the heat and people not being able to cope? I mean, has that impacted some of the other stuff that you do, having to deal with the here and now?
So this, as you say, this period is for the period ahead.
Yes.
Certainly in the last few weeks, we have seen a significant increase in referrals coming through. Haven't specifically yet analysed whether that's linked to the heat, but we are in conversations with the police, for example, at the impact that the heat is having on vulnerable adults, and an increase in the number of deaths that we've seen recently. Now, that's not related to the assessment process, that particular.
But it all comes through your door.
But it all comes through the front. So that's an area that we can look at specifically.
We could see an impact of that at a future here somewhere, couldn't we? Yeah.
Keep a watching brief on that. Are there any other questions on the performance?
Yeah, thank you. Just on the permanent exclusions rate, the data is 0.84% there. What is that exactly? Because in the narrative there, it says January figure was 1.06%, which was the highest monthly rate for the quarter. So is that data point, is that an average for the quarter, or is that what How does that relate to the?
Just talking and going back to. It's not a percentage. Jennifer now, Corporate Director, Education and Learning. It's a figure calculated against per 10,000 children.
So it's 0.84 per 10,000, correct?
So
okay.
the lower it is, the better it is.
Gotcha. Okay, thank you. It has a percentage, so I was very confused. So the January figure is a percentage. So the 1.06. No. That's also per. Okay, right. Thank you.
Any other questions on performance, or shall I move us on? Thank you very much, Chris.
Thank you.
See you next quarter.
Stand down. Stand down.
Okay, so are you happy that we have noted the report? Okay, item 11, Young Carers Services and Support. Please welcome.
Hi.
And also Prue.
Yes.
Hello.
Thank you. For anyone that hasn't met me before, I'm Louise Ryan. I'm the head of service of birth to settled adulthood.
Introduce Prue as well.
Yes, and I'm introducing my colleague Prue Caldwell McGee, who is the service manager for birth to settled adulthood in the children's area, who have direct oversight of the young carers team and services. So it's lovely to be able to come and give you an update on our work with young carers and the support for young carers in the service. I think it's primarily to give the committee an update since we've had the new carers service, the all-age carer service that began in November 25. The lead organisation for delivering that is Help and Care, but they commission and contract young carers support to My Time Young Carers, who are a specialist charity based in BCP. Since the introduction of the new service, we have seen an overall increase of young carers identified and registered with the service. So the last reported update was we were increasing to 511 in total numbers, and we expect that number to continue to increase as we go through the year. I'm just reminding you that the definition of a young carer, which I have included in the report, is a child that may be undertaking caring responsibilities that are significant and regular, or their caring responsibility has an impact on their well-being, education and development. In terms of, well, we have the young carers team that works within Dorset Council, which is part of birth to settled adulthood. We undertake, we have a statutory duty to undertake assessments for young carers and understand the impact of those responsibilities for them, which we do. So what we find, I think, when we do undertake an assessment is that they may well not have a significant or ongoing caring role, but we will always give advice and support to the family about having a disabled person within their immediate family. It might be a parent, it might be a sibling. And we can give that advice and information, even if we haven't identified an ongoing caring role, and therefore they may not remain to the carer service. So I've included the numbers at the moment. The young carer service, we're working with 78 children under 18, and the numbers for that have gone down over the period. What we found is that we are working more closely and more intensively with those 78. We will be seeing them on a regular basis, and we will be supporting them with ongoing support to access the range of social and wellbeing activities that we have on offer. We can either offer that as a group or more individually if they need support. And then once we see an improvement in their situation, if we feel that they can access the support that's on offer from My Time, we will then take a view on whether they need to be continue to be open to the young carers service within Dorset Council. Our service is monitored by Ofsted in their regular inspections, and we also provide an update annually in the annual conversation about how our young carer support services are doing. So they are very interested in how we're supporting young carers. And I just wanted to reassure the committee that obviously we work very closely with the locality teams in terms of making sure that those young carers' needs are met, and that they are getting the necessary, their needs are being well met by their families and their family network. So we do sort of monitor that. We participate closely if they are a child that has a child in need plan. We work very closely with our locality teams on that to make sure that their needs are being met. And we review that closely. I think the work that we want to do in the forthcoming year, as we've identified, is produce more guidance for professionals who will identify young carers and explain the differences between the services who help and care are My Time Young Carers and what we do here at Dorset Council. And I think we can link that into the work that the My Time Young Carers want to do around introducing a Young Carers Champion network within schools. And we can definitely do the work to tie in our information professionals alongside that, which is what we have linked in with our education colleagues in the forthcoming year to strengthen that knowledge and champion the needs of young carers. We also have we want to review the Bridget tool online, and if that could potentially be an option of support for young carers, we need to think about that carefully in terms of what AI can do and the support around that, how it can complement our services rather than replace what we're doing. So that is something that we're looking towards in the future. But as I say, if there's any questions in terms of what we've documented in the report.
Okay, I've got 2 speakers already. Andy T rather than and then Carol.
And Cohill, Wimbledon. The last time you came in, I was struggling with the concept of any 5-year-old being defined as a carer. I'm still struggling. Words have power. Nothing so aggressive today, I promise you. I would be grateful if you'd just give us another flavour of the kind of support that you can provide to young people that are in that position. And I'm also interested if you could talk about when you're talking to them and telling them about the services that are available that you might be able to tell you. If you could talk about what the context is when you're talking to them, or do you talk to them within the family context, or are they within a school context, or separately completely? Because obviously sometimes answers can differ depending on where they are or who they're with.
Yes, okay. So I think just to highlight in terms of the data that we have for young carers when we've done assessments for particularly very young carers, so we're talking about the 5 and 6-year-olds, I have included it in the report. However, we haven't, in the particular young person I referenced that was 6, where we undertook an assessment, we did not find an ongoing and regular caring role. So therefore we were able to give advice and support to the whole family around how to support that young person if they have a disabled family member in their home, and the ongoing support that the whole service can provide, because we're birth to settled adulthood covering 0 to 25. But Prue, I don't know whether you want to just talk a little bit about the team and how we do work with
yeah, sure. And I think that this is part of the work that we're really wanting to develop, is to understand the differences between what we provide as intense support and what My Time provide, because they are an established charity that have a huge programme. They do multiple activities, group activities over the summer through all school holidays, which all young carers are able to register for. Any young person can register to be a young carer on the register. They don't have to do an assessment. They don't have to go through any process. They can register. They can self-identify as a young carer, or their parent carer, person that they're looking after, can register them as a young carer. That gives those young people access to those group activities without any questions being asked. Where it comes into the more intense support, if you like, where it would be, because we've got a team of 3 family workers who are young carers family workers, that would then be that assessment so that we can really understand the level of that caring need for that young person. What that then looks like is really about what works for the young person and for their family. It might be regular communication via phone or via text, just for a little bit of support. It might be going out and taking them for a cup of coffee just to get them outside of their situation for an hour. It might be supporting them to go to some of those group activities because they don't particularly want to go by themselves. So it can take a whole range. We have a lot of young people are supported to go to university open days, because they really want to support them with their aspirations and really help them understand that you absolutely should still be able to achieve that. And I think one of the real strengths of the current model and working under the Birth to Settled Adulthood is we're doing huge amounts of work with our adult carers team to really start making sure that young people, when they are young carers, really from about the age of 16, 17, we're really helping them think about what life might look like as an adult, because what we want to do is reduce their caring responsibilities. So it's making sure that all of the other things that can be in place are in place for their care for the person, so that they can go and realise their own ambitions. And then if they are then going to have a caring responsibility, we're working really, really closely with our adult colleagues. We're doing that move across a bit earlier to make sure that young person, legally child, is really supported for when the day that they turn 18, because their life doesn't change, doesn't it? But it's making sure that the system and the service is actually around them so that they understand what's happening. I don't know if that answered your question.
And just to say, for the particularly younger end of the young carers, we do think if it's a parent that has the need, a disability, or or they're struggling to care for multiple children in the household that have a disability or additional needs, then we can take the view and we can do the assessment for the whole family, and we can consider short breaks that would then, if the parent is not able to spend as much time with that young child in the house because of the impact of the other person's disability, we have the ability to take quite a broad view and consider whether we can offer short breaks to alleviate some of those responsibilities, so that the individual child gets more time and can spend quality time with their parent.
Before I move on, it is 6 minutes to 1. I need your permission for us to go beyond 1 o'clock. Pose. Thank you. Okay, Carol.
I think it's great that they can young carers can self-identify, but I wonder how many of them think of themselves actually as a young carer, because it's just what they do. So there was that, and I wonder whether we've ever actually got any stats to show the average school attendance of a young carer.
My time have done a huge piece of work. And I'm not going to be able to remember the stats, but they have done it. They have calculated the average number of days a young carer probably loses. Right. And the interesting position of them is that the young carers are more than likely, because they're late, because they don't want to get into trouble, they say, well, I'm not going to bother then, rather than for any other reason not going in or being worried about their cared for person. It generally might be because I've had to help in the morning, so now I'm going to be late for school, but actually if I go to school, I'm going to be in trouble. Yeah, I don't want to be in trouble. This is where my time have got this programme that they're wanting to put a champion in every school, and it really is to increase that knowledge and that awareness, so that we can what we'd like to do is do an awareness campaign. What I would like to do is do that into all schools, into GP surgeries, into pharmacies. I mean, I would like to put it everywhere, but I think Paul might have something to say about that. But we really do need to work out now, where do we need to target communicating? Because even I was looking in my own GP surgery the other day, and there's just a little flyer sort of tucked away. And it just says, are you a carer? We're not specifically saying young carer. We're not talking about, are you under 18? Because you won't recognise yourself as a carer, because exactly what you said, that's just what we do in our family. And that's not to say that that's wrong, but it's important that you're recognised for those things that you're doing that another young person of your age typically wouldn't be doing.
And do you think that we can find a way of family hubs getting more involved in looking at this or working with young carers? Because that's not part of, I mean, at the moment, family hubs will have, I think it's 24 designated service areas, but that's not one of them. And I actually think it could be, and it should be perhaps. And I wonder how we take that forward.
Yeah, that's useful. We will think about that because we know obviously family hubs do offer SEN support, and I think it's really important to highlight the relatives, you know, anyone in the household or the close-knit family that might be affected by that. And obviously with promoting, working really closely with My Time Young Carers and increasing the awareness, we can improve understanding, and hopefully that will relate to young carers knowing they won't get in trouble for lateness, and it will have a long-term overall impact in improving attendance at school, which we will all work hard to improve on.
Just picking up on that late attendance issue, talked about the fact that they're going to be late and therefore they perhaps decide not to. But in the rural area, if you don't get the school bus, you're shafted for the day.
And that's another reason. Absolutely. Absolutely.
Yeah.
Oh, you wanted to come in?
Yeah, just to add to the points that colleagues were making. My Time came to my extended leadership team meeting a couple of weeks ago, did a fantastic presentation, and where they're working with particular schools, attendance has gone up for those young carers because the schools are adapting they those children once they know and once they've been through the awareness program. So that is really good and felt like a real easy win. So I think by the end of the meeting, I was very much persuaded that if I can find the resources to invest a bit more in their service so they can do more across more of our schools, then I'd be very happy to do that.
From, should I say, not personal, but I have a neighbour who is a young carer, and they report well on their involvement with the service.
Thank you. Harwood, Gillen Ward. Just looking at the report, there's a bit here that says some young carers have been closed due to no contact. I'm just wondering, is there a process around that when you lose contact with these young carers so they don't drop off the map, so to speak?
Yeah, I think that's, I'm sure that the team will be regularly contacting, making sure that we are having regular contact. So at least on a sort of 4 weekly basis, I think. So if they try several attempts and then they do not get any contact, then I think we would write to them and advise them that they are probably going to be closed to us. However, always invited that they can contact back through the family advice and support line should they have any difficulties, and also obviously they have their contact with the carers service, help and care, and My Time as well. Yes, that they would be advised of what to do if they had a problem.
So it's not like, I guess, a welfare check or something, like if there's some nefarious reason there's no contact, for example. Is there a checkup on that?
Not as such. I think the family workers have, with the young people that they've worked with, they know the families very, very well. They know the young people very, very well. So I think if there was concern to that point, they would certainly be speaking to their manager. And I think Louise has highlighted in the report, the team manager is a qualified social worker. So she always puts that safeguarding hat on whenever she's looking at that decision making. So I think that there would be advice and guidance that would be gained. Obviously, we can't go steaming in, as you'll appreciate, but what could we do? Can we check with the school? Can we, so just to know that the young person is okay, but just has chosen not to engage anymore. So yes, there would certainly be a level of oversight, but it would be informal.
Sally and then Andy.
Sally Holland, Chesilbank Ward. You mentioned you've got 511 at the moment and you expect it to increase. Do you expect that just from unidentified carers at the moment, and that's, you're hoping that more people come through? Is that the hope, as opposed to new people needing caring for, being cared for?
Yeah, I mean, it's all young carers, but I think it's probably going to be as a result of hopefully the awareness increasing, that when they're informed about the services and they reflect on their own position, that they're able to get in touch and reach out for support.
It's a wonderful thing you're doing, because I was a young carer back in the 60s and 70s, and it was just us really. We just got on with it. But I think it's fabulous to be able to give that support.
Right, thank you.
Yeah.
And excuse West Moors on three-legged cross. I'm always slightly saddened by the term of a young carer, because they take on a huge responsibility and to the cost of their own progression sometimes. And I'm really buoyed by what you say about what your work is and what it's doing. Is there a sort of is it something that is evenly spread all over Dorset, or do we have particular areas, or is it the conurbations that we pick up most young carers? How do I know you must know where they are, but of course we don't, but is it spread everywhere? And if it is spread everywhere, I noticed we've got an access to a beach hut on this end of the county, but not the other end. So why not?
We haven't got beach.
We've got one close enough, which is in Bournemouth or Christchurch.
Through the chair.
Naughty girl. Haven't got
So I think we have the ability through our dashboard to be able to report on the locations, because we would have postcode areas, wouldn't we? So I don't have the data in front of me, but certainly we would be able to have a look at that at a bit of a deep dive and give an idea with an updated report in due course about the spread. We do have the beach hut on the one side of the city, don't we, down in Swanage, but then we also have other things such as, like, the National Trust, for example, has given us use of young carers cards to be able to access facilities, and I think that's a little bit more evenly spread in terms of where the access is. So I think there's different offers depending on the location, but obviously if there was a real gap in terms of being able to offer young carer support in a certain area, I'm sure that My Time would be able to flag that with us, and then we would be thinking about what we could do to overcome.
More value comes to mind.
Yes, exactly. But certainly would appreciate, welcome to give you an update on that next year.
So I don't have any other questions. A couple of things that we've obviously picked up during the discussion is the request that you take a closer look at family hubs as being a dedicated service area, and also picking up what Paula said about the My Time project in schools. I think the committee would support both of those suggestions.
Definitely.
So if we can, that's our recommendation.
Yeah,
We would like to see.
Great. Yes.
Juliet.
May I make an observation, because it's fabulous listening to Louise's detail. Just looking at the statistics for adults, is actually we have really low numbers of carers in the age group 18 to 26 coming through to adult social care for a Care Act assessment, which is part of what we do. And I just wonder whether there's a piece of work that would be beneficial for us to do to understand why we have this small community of people, because one would have expected young people with caring commitments to continue to have caring commitments unless those opportunities for them to have support in a different way are met. But it just, while you were talking, it just puzzled me.
And need.
Well, this is, yes, it would be useful to understand what
is being met at one end, but not being met at the other.
Yeah, I think the question is, we don't know.
So it just struck me as Louise was talking.
That's something you use comms for, to widen the knowledge about the.
Yeah, I don't know what my problem is.
You know the age.
Recognise that I appear to have, given how many young people aged up to 18 are supported by the young carers. My statistics would indicate that there is a smaller community of people that we're doing formal assessments for in the 18 to 26, which then jumps up in the 26 to 64 and then the 64 to 85. And I need to understand, I think, why that is. So just
why don't you get your heads together?
Yes.
Get our heads together. Look at what the gap analysis is.
Yes.
And then if necessary, come back to us and try to, see where it takes you.
Yes.
And we can either look at it here or perhaps overview or wherever it needs to go.
Yes.
See how we can help.
because again, if we have a birth to settled adulthood cohort, which we do, young carers are defined by their legal age up to 18, but it's still a legitimate scrutiny for us to do, I think, in the birth to settled adult.
Yeah. I mean, what I can say, what the practice is on the ground is that the young carers service and the adult carers service are working really closely together to talk about those young people that do need to move over to adult services. Those introductions and warm handovers are happening. But if we are not seeing the numbers come through that we would expect, then we do need to ask the question why, what are the under.
Some of that might be legacy because obviously the service is changing and improving year to year. So
yes.
Just very quickly, I mean, the optimistic take on that is that lots of kids reach 18, go off to university, and then the care need is met in another way. But obviously,
potentially, But I think the important point is we need to know why, rather than just speculate what it could be. Another little job for you. Okay. Are we happy with that? Shall I move on?
Yeah.
Fantastic. What's the delivery report? Hi Laura, hi Matt.
I think I'm going to start off by introducing this one. So I'm Councillor Matt Bell, Cabinet Member for Public Health, Prevention and Communities, and also Ward Member for Radipole. I'm pleased to introduce this report on the impact of Dorset's cost of living programme during 25-26. Whilst national attention, I've got an IT update that keeps flashing up in front of the screen.
It's done that call to us all. Yeah. It'll take about 3 or 4 minutes.
Speak quickly. Hidden it. Whilst national attention may have moved on from the immediate cost of living crisis, many Dorset residents continue to face significant financial pressures. We've got rising housing costs, energy costs, debt, food insecurity, and transport challenges that continue to affect some of our most vulnerable households. This programme has enabled us to respond to those pressures through targeted, evidence-led interventions that not only address immediate need, but also help prevent people from reaching crisis point. This report demonstrates the breadth and impact of that support. Through funding approved by Dorset Council, working alongside our voluntary and community sector partners, we have helped prevent homelessness for 155 households through direct financial assistance, support a further 783 households through discretionary housing payments, secure 131 private rented sector lets through landlord engagement and incentives, provide 135 essential household appliances to 99 low-income households, enable 1,001 residents to access citizens' advice support, resulting in over £1.3 million in positive financial outcomes, support more than 1,000 older residents to access welfare benefits they were entitled to, generating over £1.5 million of additional annual income, and invest in community transport, affordable food projects, energy improvements, and holiday provision for children and young people. What is particularly important is that these figures represent real people, families who have remained in their homes, older residents who can now afford essentials because they're receiving the benefits they're entitled to, disabled residents living in warmer and more energy efficient homes, and children who have been able to access healthy meals and enriching activities during school holidays. The report also shows the value of taking a preventative approach. By intervening early, often through our trusted community partners, we can reduce demand on more costly statutory services, such as temporary accommodation, crisis services, and emergency support. In a moment, I'll hand over to Laura Cornett, our business partner for communities and partnerships, who'll be able to provide more detail. But before I do that, I would just like to share my thanks for Laura's determination to make this programme as impactful as possible, and also to all those involved in the implementation of this vital work. At this point, over to you, Laura. Carry on your fine work.
You can now update, Matt.
Yeah.
Got there.
Thank you very much. And actually, I haven't got too much more to add. So the report hopefully does very much sell itself. I just wanted to draw the committee's attention very quickly just to item 7.2, where I think one of the successful measures of our cost of living programme is, as at the beginning of April, the government replaced the Household Support Fund with the Crisis and Resilience Fund, which, although are similar on the surface, are actually quite different underneath. But actually, since we've had this since 2022, we have been able to mobilise incredibly quickly into the new Crisis and Resilience Fund, or I'll call that CRF delivery. Because we've got that strong infrastructure, established voluntary sector partners, effective referral pathways. So it's enabled us to get moving much quicker than many other local authorities, and also support from Cabinet and various committees in getting a very, very quick, like day one crisis support agreed at the end of March, and going through the committee process at the moment, coming to Cabinet at the end of the month, a kind of a slightly more longer term view. The programme, the CRF programme, will continue to evolve. It's a 3-year programme. What we've got in place now is not where we intend to be in 3 years' time. But what will continue to happen is this commitment from Cabinet for this additional £500,000 will continue to complement and strengthen any other government programmes that we have. And so I just really wanted to kind of make that kind of quite clear within this, and also happy to take any questions at all on the individual reports. Also, was looking retrospectively this year of activity that happened in the last financial year, 25-26.
Not really thought through this question, so bear with me. Forgive me. Homelessness prevention. Got £367,000 total spend prevention. So first part, what would they cost if they were to go into housing? If we were then to be providing them with accommodation because the private sector had let them down, what would that then incur for us as a council? So how much are we effectively saving? And the second question is, you've got a lot of subsections. Is there any value within this homelessness prevention, page 403 I'm looking at? So arrears, rent, tenancy sustainment, media and information awareness, food vouchers. Do we not break those down deliberately, or is there a way of having a look to see where the money is being spent and where the value is?
So I'll answer the second question first, and I'll come back to the first question. So there it's an overall figure. When the housing teams submit their request to me, they do break the funding down. So there is like a mini budget allocation for every single item. There's 4 projects within one department there. So when they do report to us, they do report it in that they don't give a full geographical breakdown for every single figure. As you can imagine, the team is incredibly stretched all the time. So actually sometimes it's about data reporting. Looking forward into the CRF, one of the areas that my team have been doing a lot of research into is what's called an end-to-end kind of system. And I did talk, and if anybody was viewed overview, I did talk about this a couple of weeks ago, where this will give us this will be a system that enabled us to follow a person's journey all the way through wherever they access the system. So whether it's within our housing or within a voluntary sector partner, but it tracks that person's journey and it gives us all the data and information that we need, and also does things like warm handovers. So they may come in for one reason. So for example, they may be homeless, but then they also get lots of resilience services and like very person-centered resilience services. So this system will enable that officer, or by officer I mean any person that professional person they come into account with, is to do those warm referrals whilst having that conversation with that person, so we can track everything a lot better. We can get them, which will enable us to get much better data. At the moment, the systems we have in place are a little bit manual and do take a lot of manipulation. So sometimes, and also our voluntary sector organisations, they're very, very small. They want to be outdoing when we're asking a lot of information back from them. And of course, because the CRF is a national DWP, Department of Work and Pensions programme, we have a lot of data as a council we need to give them, and unfortunately we have to pass a certain amount of that on to any of our partners, and that includes homelessness partners as well. and that's both within our housing teams, but also our really key delivery homelessness partners out in the within the communities. So to answer your question about savings, the most expensive form of housing for a family is temporary accommodation, so bed and breakfast. So the quicker we can move any resident, so whether that be a family or a single adult male, into either proper temporary accommodation, or obviously the best outcome is a permanent home, that is the cheapest solution for us. And that's why we have invested a lot of money getting ahead on prevention. And it is showing we are well above the national curve about getting people out of those bed and breakfast, that really kind of short-term temporary accommodation. And we are reaping the benefits from that.
What's the headline so that I can say every penny that we invest in you is saving us this?
Oh gosh.
We need to get that from housing, I'm afraid. So I can get that for you. But it'll be a little bit speculative, because it's for example, a single adult male, to put them into bed and breakfast, that's one room, one night, is obviously one cost. If we were rehousing a family of 4, they are really quite different. So I will speak to housing and see if I can get some figures.
One follow-up, if I may. No, it's fine. How many are we missing? How many slip through the net and that we don't get help to in time that we could with more resources available?
Yes, there will be some. And we are always trying to link things up together. The CRF will enable us to do that a lot more effectively, which is why we have this one system for everybody. We've also done a lot of work with our adults and children social workers, our homelessness teams, our citizens advice colleagues, and lots of other voluntary sector organisations. So it isn't just about where people come into help, it's the wraparound.
Early warning system.
Yes, absolutely. And prevention is much more effective than when they do reach that crisis. And one of the fundamental points of changes between Household Support Fund and the Crisis Resilience Fund is that there shouldn't be a crisis payment without personalised wraparound resilience services. So say, for example, someone has come in to, I'll use citizens advice as an example, because they've got themselves into a lot of debt. Citizens advice can do their normal things and getting things written off and agreeing those, but then there's that much bigger picture. Does that person need financial education? So we're currently trying to commission across the whole of Dorset Council area community-centred financial education courses, and that will be for all of our residents. We're developing special courses for care leavers and older residents, working together with families in schools, and that's just one example. But then, of course, you've got mental health services in there as well. They may not have reached those kind of high-level services, but we're linking with the NHS access to wellbeing hubs, which are a ladder system anyway. So there we will be strengthening through this that wraparound. So unfortunately, there will always be residents that will slip through those cracks. This system is designed and we are working much more together as a council. So we're not working as siloed with this. So that to enable people to wherever they come into the system, we'll hope they will get the right support, and it will stop as more people falling through those cracks. And also it is more money invested within them as well. So.
Yeah, I think some of the figures are actually better than you're able to report, because if I look at the family hub that I'm involved with, for example, we commission our own citizens advisor who I think last year brought in something like £170,000 worth of extra financial benefit to people coming through. But a lot of what we do is helped through the funding that we get from Dorset Council. One of the areas that we've seen an upturn in lately that don't come through you because we can sort it out ourselves is homeless men living in their car after a marriage breakdown. And that can take some while, but that's something we just sort out. I mean, we're also a BBC Children in Need referrer, so we also get white goods and beds and cots and cribs and all the rest of it. So I think your money, well, the Dorset Council money, it goes a little bit further than you anticipate. But in terms of providing that data, there isn't a system that's easy or manageable, and especially when you're at the front end and you're trying to do the stuff to actually then sit down and really start working out the data is going to be a challenge. Sorry, carry on, Matt. You've got something to say.
Carol, to help strengthen that, our commissioned infrastructure organisation, Volunteer Centre Dorset, they are giving data advice to smaller voluntary sector organisations on how to report their work much more effectively without taking up too much time. And then the view is that so by the end of this financial year, we hope to have commissioned this new end-to-end assessment. Obviously, there will be a period that we're able to embed, but everybody should be able to have access to that at a level that is appropriate. So, you know, for our tiny food banks, we're not going to be asking them to fill in 10 pages of individual personal data, but so it'll be appropriate and relevant. And also just to reassure you, Councillor Jones, when it comes to the hub, one of the asks of Cabinet going through is actually financial support under the CRF. So we're using government money to booster up that wraparound support for food food security organisations. We did an audit of all of our food banks and social supermarkets that we do fund, which was funded, it's funded through cost of living. Almost all of them are offering some kind of wraparound already. And we want to strengthen and build that because that is what the Crisis in Fund is about going forward. So please watch this space. We are working really hard and it is coming. Cabinet is on the 28th of July.
Thank you, because I think you're doing a bloody good job. Just language.
Yes, thank you. Just on the community transport that I didn't quite understand fully the narrative that was in the table. It looks a bit jumbled up. So if you could just clarify that a bit. But it does seem to acknowledge the fact that it's been underfunded for a while. And then there's been an overspend on that in the report. So are we looking at maybe the coming year an increase in the funding for that, or how are you planning to resolve that?
So the department, so our community transport team, do not have a large core budget, so a Dorset Council budget at all. So for the last few years, we created the fund. There was no fund before our cost of living money came along, and this supports all community transport with the kind of what we call core costs, so insurance, volunteer expenses, because we all know volunteering is not free. Things like vehicle maintenance, driver training, lots of things. Because we're changing from the Household Support Fund into the Crisis Resilience Fund, we weren't able to roll it over as part of that day one request because the agreement was we just asked for crisis to roll over while we did assessments. So we've done that assessment now. So the continuation of the community transport is coming forward to the next Cabinet. It is set at the same level. However, we have got flexibility. It was overspent, but under £1,000. I have got other pots I'm able to move things around from, obviously with appropriate sign off. And to move £800 for me is not, it's not a big issue. Though it's overspent, if it was £10,000 overspent. But I think there's always got to be there has to be an audit control, a level, because all of my projects for cost of living or for Crisis Resilience Fund or any of the core grants programs I look at, we could got triple, quadruple what the applications that we get in. So there always has to be a process. The committee the fund committee that sits for the community transport grant, they obviously do look at all the applications and we assess it against the criteria for that. So they will only ever fund those projects that will really satisfy that and help us meet the requirements of our council priorities, our community priorities, and also going forward the Crisis Resilience Fund priorities. So we are very lucky in the fact that our Cabinet have always said if things, if you do identify a further need, do come and ask. We haven't had to do that so far because, like I said, we've got quite a few budgets we're able to move things around from. And sometimes, for example, the cultural and community project fund, which is a core grant fund, sometimes that might be slightly underspent because we may award a grant and then for whatever reason that community group may not be able to deliver it. So then we would then take that £5,000 back. So I always like to try and reallocate that funding within that budget out to communities, because I see it as my role that I've been given that responsibility to spend that money for the benefit of these communities. And so I'll always try to meet that rather than give it up as an underspend.
Andy.
On page 404, item 4, discretionary housing payment allowance, which was 48,000, it showed an additional 25,000 was put in. Was that a planned one, or is that because I saw there was an underspend from the previous year, or is that us underfunding it? Are we significantly not putting enough money in there? You moved 25k from there,
yes.
So that's not a small amount.
No, so
840 quid, sorry. Sorry, Carl.
Thank you very much. Yeah, so the previous year we did have an underspend in that area. So our section 151 allowed us to, rather than give it up as saving, because obviously we'd allocated the 500,000 for that. Yeah. Now last year, and obviously please forgive me, I wasn't involved in the housing conversation you had earlier. So obviously the renters reform bill came in March. So there was a really negative knock-on effect with many of our residents in private rented accommodation. So many of them had their rents increased significantly. Many were given notice. So we have experienced an unprecedented demand over the last 12 months with residents who wouldn't normally work with us because they are in private accommodation. They both one parent or two parents have got jobs. You know, they're just above those thresholds and they cope really well. But they don't necessarily have that wider resilience when rents are increased by £400 or £500 a month, or they're given notice and they need a 4-bedroom house and there are just no other 4-bedroom houses available for them. So we had a lot more people coming in to apply for the discretionary housing payments. So that's why, to enable those officers that do those assessments to actually be able to support people to a level that could either keep them in their homes whilst they found more appropriate accommodation, so give them a bit of breathing space, or enable them to give a deposit to help get into the next property. So i.e. to stop them from becoming and going into temporary accommodation, because obviously that does upset the family. You know, children get taken away from their school, you know, people get taken away from their jobs, and that really destabilises the family. So to enable the revenue and benefits team who do those assessments to do their job, we thought it was appropriate to seek additional authority to increase that. And you will notice for this financial year, they've got a higher level, and coming through Cabinet, actually I've asked for even a little bit more money because we are still experiencing the knock-on effect of the Renters Reform Bill coming in.
Well done for hiding 25k from Nick, but I'm sure it wasn't like that. You've done well.
Thank you.
It's an important point that you raised there about the increasing demand. And there was a comment earlier about people dropping through the net. And I was just thinking, obviously the amount of funding that you've had over the last couple of years has changed quite considerably. It's gone down in real terms. How much of an impact has that had on the work that you've been able to do?
It's enabled us to work, well, we do work differently. So obviously, I've got to be careful here because there's some political change within Dorset Council. So originally it was a 1 year, £1 million support as a one-off. And then with our change of administration, it was less money, but for a longer period. What it did in that time is we worked much closer with the household support fund because there was a natural overlap, and that's why some of the projects are duly funded between the two, which was itemised. That has continued into the crisis resilience fund. With the crisis resilience fund, we've put slightly less money from government. I think it's 12% decrease. However, we also received an additional just under £500,000 specifically to support oil heaters. Our residents have oil heating, which we're now allowed to use for general crisis funding as well. And the household support fund, we spent over 50% of it on supporting families with free school meal holiday vouchers, which the crisis resilience fund excludes us from doing beyond this summer period. So we have got more money to help people in a much more person-centred way. Going back to your question about renters reform, one of the things that was most successful, and it was a very small amount of funding. So within the housing profile, there's 4 projects for housing. One of them was £10,000 for media. So we did a really, really great communications campaign with Shelter, with Citizens Advice, within our local family hubs, really pushing our residents. When you get in, when you're starting not to cope with your home, come to us before you reach crisis points, so before there's eviction notices. And that was incredibly successful because it meant our tenancy sustainment officers can actually get in and work with those landlords before people are turning up at our doors with their suitcases. So so £10,000 is really small compared to all of this, but probably equally as effective as many of these much bigger funded programs. And we will continue to do that this year and keep going as well.
I was going to say, be able to continue to do it now that you've settled the groundwork and you've got your package. It's going to be cheaper to roll it out in the future, isn't it? Because you've already done that groundwork.
Yeah, and the homelessness team have done so much work with private landlords. So with the Renters Reform Bill coming in, our teams were holding webinars, building those relationships with those private landlords, because obviously quite often we don't have much to do with them because they are a private business, so unless they need something from the council. So we do lots of really great work with our housing associations, but having this Renters Reform Bill come in, they've needed our help. So Samantha Brand, who's head of homelessness, she has done her team have done some wonderful work, and it's their team that have the tenancy sustainment officers that have worked with those landlords to build relationships, negotiate where appropriate, keep people in their homes, even for a temporary period, to enable them grace to find accommodation and things. So this is where the preventative agenda really has been effective. And I will get some figures, but it has saved us, I think, a significant amount of money. If every single one of those 151 families were put into a temporary accommodation, the cost of the local authority would be a lot more.
Just in response to your comment about the funding, the change of administration, yes, it was a 1-year grant, but who knows what would have happened in the future.
Yeah, sorry, I'm not political. I was just stating that.
It could have been 1 year. It could have been something that was a pilot.
Apologies. Yes.
If things have gone a different way, it could be a completely different answer. So we'll just leave it there.
Thank you.
Okay. Are you happy with what we've discussed?
Yeah.
Thank you.
Thank you very much.
You're welcome. Very much. Thank you for your support with this, and also working with you as we go through cabinet to develop the new crisis resilience fund. Yeah.
And then we'll be there to look at how effective you've been with those new. We mark the homework.
We welcome it. Thank you.
Thank you both very much. Nice to see you, Matt.
I'm staying for the next one.
Oh, right.
Under my brief as well.
Lucky
We're
you.
a bit late in the day, sorry. Dashed in at the last minute.
No, that's absolutely fine. So, Andy, are you going to be taking us through this, or are you going to introduce it, Matt?
Yeah, I'm going to start us off and then I'll hand over to Andy.
Okay, so Community Safety Scrutiny Report.
Absolutely. So just in case anyone's come in for this item, I'm Councillor Matt Bell, Cabinet Member for Public Health Prevention and Communities. So members will be aware that there are numerous statutory responsibilities placed on the council relating to community safety, along with specific duties relating to preventing violent extremism, modern slavery and domestic abuse. Dorset Council is responsible for working with partners to identify and tackle priority community safety issues in our area and produce and deliver key plans, strategies and reviews. We do that through the Dorset Community Safety Partnership, CSP, a statutory body that brings together ourselves, Dorset Police, the Probation Service, Dorset and Wiltshire Fire and Rescue Authority, NHS Dorset and other key organisations. Community safety partnerships must undertake assessments to determine the priority issues in their area and develop community safety plans that address these. They're also responsible for developing and delivering reducing reoffending strategies, and in Dorset, the CSP has taken responsibility for our local serious violence strategy and helping the council produce and deliver its statutory domestic abuse strategy. In addition, CSPs are responsible for producing reviews where domestic abuse may have been a factor in a person's death. The learning from these reviews is used to help improve and develop local services. CSPs are held to account by local authority crime and disorder committees, which in Dorset is the People and Health Scrutiny Committee. This annual report provides information on the council's and partners' work against their statutory responsibilities. It also includes a brief update on the council's work regarding In a moment, I'll hand over to Andy, our service manager for community safety, but I just want to place on record my thanks to Andy and his team for his knowledge, diligence and dedication and bringing me up to speed. Over to you, Andy.
That's an intro and a half.
It is. I'm not sure I can follow that, Chair. And just, thank you. Just so you know, my laptop keeps stopping. So, oh, okay.
We're all running updates in the middle of the meeting, and it is so frustrating.
Yeah, I just had a moment of panic, thinking, where have all my notes gone? So, please. Yes, it certainly is. Thank you, and thank you, Chair. And I'll just briefly mention that obviously we're presenting a lot of partnership work here, not just Dorset Council's work. Not all partners can be here, obviously, but we'll do our best to kind of represent all of that. I'll just go very briefly and highlight some things from the report. So on the community safety plan, which is our most significant plan in some respects, our overarching plan, that concluded, the latest one concluded at the end of March, and there's some details in the report about the activity undertaken. I have included some performance information in the report, but it's worth kind of saying that interpreting crime data is not straightforward for many reasons, influenced by lots of different things. And we've spoken before at this committee about some of our work around awareness raising and increasing confidence to report, for example, can actually lead to increases in certain things such as stalking and domestic abuse, so on, as people become more confident to recognise issues and report them. The new community safety plan was recently agreed by partners. As you can imagine, the themes have remained fairly consistent. They have for a number of years. But we have added hate-related crimes, a cross-cutting theme. Now, hate-related crime is one of those things that isn't actually a criminal offence itself. It's something that gets tagged on to something like an assault or harassment. So a cross-cutting issue makes sense to have it as a cross-cutting issue. And although hate-related crimes in Dorset are low, they do have a huge impact. And by having it in plan and involved in the plan, it does mean that the CSP can help monitor trends, respond to trends, but also link into wider work that's taking place around community cohesion and generally that community's work. So really good to have that in there. Reducing reoffending, I mentioned the strategy there. It does contain several indicators, and if committee members would like, I can give an update on progress against that. Really good work around tackling serious violence, and we've seen some good performance information around there. The performance information on serious violence in the report reflects our local definition of serious violence. So we had a duty placed on us to tackle serious violence, but we had the ability to define what serious violence was to us within a suite of things. So in Dorset, for example, knife crime isn't such a prolific thing, but other things are included within our definition. And our approach to tackling domestic abuse continues to strengthen with the domestic abuse strategy, new services, new opportunities. The last part in the report just mentions about some of our work around preventing violent extremism, which is a council responsibility, but some of that we do in partnership. We do a benchmarking exercise every year with the Home Office, and we are compliant in all areas and exceeding expectations as well. So that's going very well. And we've spoken before as a committee about the role of members in relation to prevent, and I've mentioned that we've sent out the Home Office Prevent Handbook for elected members, and that's still available. I'm conscious of recent events as well, and I understand the council's monitoring officers emailed all councillors around information regarding their personal safety and so on, Chair. That's a very quick run through, but happy to take any questions.
Thanks really quickly. That handbook, that was sent out quite a while ago, wasn't it?
Yeah.
I think it would be worth, given sadly the recent news about Anne Widdecombe.
Sure.
Though sadly it mainly tends to be MPs that are targeted in this way. There have been instances of councillors in running their community surgeries where they've been attacked by people as well. So I think it's probably a good time just to recirculate that so that members can perhaps refresh.
Sure.
You know, we all need to try and stay safe. And your comments about hate crime, sadly Jane can't be here today, Jane Somper, but I know that's something she is very, very keen on to highlight and has raised it several times in committee and council. So I know that she'll be very pleased to hear that update. Members, any comments? Andy?
I'm hugely supportive of everything you do. I am, however, going to say I hate your graphs. They're so small, you cannot see the details that are in there. This is a scrutiny committee, so we kind of want to look into the data. I'm going to ask, because I can't tell. Firstly, you touched on it before, crime reporting changes, just doing your job and making it easier for people to report crime affects the data. Yeah. All of that context needs to be included in here. Is the data in a lot of these graphs proportional to the change in the demographic of the population within Dorset, or are they absolute numbers? If the population as a whole has gone up, one would expect, all other things being equal, that the number of crimes would go up in proportion to it. I can't tell from the data whether that's what's going on here as well, or whether, because you look at most of the, but some trends, some trends up, some trends down, but a lot of them are broadly flat, which will hide whether or not there's been an underlying change, whether the work you're doing is working or not. Because if it's flat, but the population's gone up enormously, you can't see that this is an enormous improvement. That's the bit I'm looking for. I can't quite interrogate the text.
Absolutely, and I could spend hours statistics, which I won't do. Don't worry, I won't do. But actually, I don't know the answer to the question in terms of that. Sometimes we have in the past looked at levels of crime per thousand population. Happy to bring you or provide some statistics regarding that, if that would be helpful.
And with a rider to say, and we are reporting them in exactly the same way as we were 10 years ago at the same time, because
yeah, I mean, part of the challenge with statistics, a lot of the statistics we use are police-based statistics, and they are often subject to changes in recording standards, different definitions, different ways that they do things. So it's
things like murder.
Absolutely. Fortunately, murder's very infrequent in Dorset. But things, things like the way, and social behaviour is a great example, isn't it, of one of those things where the definition becomes very difficult to kind of classify in some respects. But even things like domestic abuse, which again is a kind of flag on another thing, and so on. So it's never straightforward. But I absolutely take your point. I think for our purposes, we try and use the performance to indicate areas to explore. So it's not really a case of saying, are we hanging our hat on saying, well, we've done that, we've made an improvement or not. It basically leads to further questions. So my question, for example, for years has been, can we challenge that assumption of domestic abuse continually going up as being something as a kind of, we're increasing awareness raising and confidence. At some point it should plateau if our prevention work is
once it is entirely socially acceptable for somebody to say I'm being abused in the home and leave, then you should plateau.
Yes.
What we're going through at the moment is a transition where society is changing still.
Yeah.
That it has to get to that point.
Absolutely, and I've said this many times, and for me personally, I don't want to be here in 10 years' time thinking domestic abuse continues because there are new cases. So we really do have to balance out that prevention work and make sure our prevention work is effective. And actually, you'll see from the statistics, one of the ways that we've tried to understand that better is by not looking at domestic abuse per se, but looking at repeat victims and repeat offenders of domestic abuse. Because we know that at the point where someone comes into our services, we're working with them to try and prevent further harm. And actually, we've seen reductions in terms of the proportion of repeat victims and so on, which on the face of it sounds positive. I can never say guarantee, but it's that kind of level of inquisitiveness we're trying to bring to this, rather than just thinking, well, it's gone up or down or left or right. But I do take your point about population, and happy to sort of provide some more detail. The only challenge with that in Dorset is because we're a tourist area, the numbers increase significantly at certain times of year. But happy to look at that and see what we can bring to provide a bit more detail.
And bring it back to committee as a report. I'm just wondering whether it would be better to have that discussion with Liz Crocker.
Yeah, sure.
About the performance measure indicators, and whether there's something we can do so we can track it that way.
Yeah.
Then if we are starting to see trends,
yeah,
then we can perhaps raise it to bring it back as an issue, a deeper dive issue.
Yeah, absolutely. There are the community safety partnerships measures are replicated in the corporate performance reports. But I'll speak to Liz and see how we can make sure.
But specifically about that correlation between population and levels.
Yeah, sure. No, that's yeah, happy to do that.
I don't know how other members are finding it at the moment, but I am absolutely inundated with antisocial behaviour, but from people within their own house that's affecting their neighbours. And it's things like smoking weed in the garden, so children's bedrooms windows have to be closed, and lots of shouting, comings and goings and all the rest of it. And nobody really seems to take that terribly seriously, or to get anything done is near on impossible. But it's absolutely blighting the life of neighbours. I mean, I've just lost count. I've had so many lately, and I just get so frustrated at the lack of anything that can really be done. And I know all the antisocial behaviour officers from Sovereign, which is SNG from our area, but to get anything done, it's so difficult, and I just don't know what we can do.
Shall I pick that up, Councillor?
Yeah, lovely.
So I'm John Newcombe. I manage the operational side of community safety for the council. So Andy looks after the strategic stuff and the community safety partnership, and I've got the operational teams. We've seen a huge increase as well. So we got to the point last week actually that we've pulled together an advice note for people when they log complaints with us, because it's not a criminal offence. Police aren't particularly interested unless there's an inference that there's dealing going on from the property. So we're working with the housing associations to try and deal with them, because they've got rules that they can enforce through their tenancies. But it is really difficult, and there has been a massive influx, a massive increase recently. So we're trying to work with partners. So we have partnership coordinating groups, which are sort of, they recently changed their name to MAPs. So they're multi-agency partnership groups, which are locality based. So they run along the lines of the old district council setup. So there's 5 groups. So Weymouth and Portland's the busiest, Purbeck, North, West and East. And we sort of manage those in terms of the sort of secretariat support, and they're chaired by the police. But we invite housing associations along, and we have individuals that are discussed that are causing issues, causing problems, and then we work out who's going to take a lead on that subject, on that matter. And we've got about I think it's about 209, 210 roughly live cases at the moment. And quite a few of those are ASB based in terms of neighbour disputes, and also drug use, late night coming and going, rowdy behaviour. Some of it's cuckooing, so it's a little bit more serious when people coming in taking over. And each one's complex, and none of them have a quick fix. So we've got quite a few tools that are at our disposal. So we sort of start off with verbal warnings, and then we escalate that to written warnings. We might do acceptable behaviour contracts. Then we can do community protection notices, community protection warnings. And then if we venture into severity of sort of criminal behaviour, then we get criminal behaviour orders through the courts with the police. So we're incredibly active. I think last month we had about 400 interventions last month in terms of trying to deal with people. But this smoking weed is a real bugbear for us, because if you live next door to someone that's sort of smoking incredibly strong,
all the time,
smelling, which is impacting, it can come through the walls, can't it? It can come through the door, can come through the ventilation system. And we are struggling with partners to try and tackle that. So that it was literally last week that we signed off this advice note, just explaining to residents what we can do what's the extent of our powers and what we will be able to help you with and what we won't be able to help you with. So I'm happy to share that with
Can
you.
I
if that
have a
helps.
copy? Yes,
Of
please.
course, yeah, no problem. at
By
all.
this afternoon.
Yeah, I'll pick it over to you straight away.
Can,
Yeah, no
can you,
problem at all.
can you share it with all members actually?
Of
Because
Yeah, no problem at all.
I've got a couple of issues within my ward that one I've been dealing with that's gone quiet for a while. One I've just had resolved after 18 months. And then there's another one that one of my colleagues is dealing with. So that advice note would be really helpful to us to understand the process, particularly if we get, I'm sure it's not you, but we get the brush off.
Okay, we try really hard not to do that.
Yeah.
Because we work for the council, so but we get the brush off, and so we try. We're sort of stuck in the middle quite
But
often.
it will help us understand and maybe
Absolutely.
be able to work better with you to try and resolve some of these issues.
I'll pass it over. I'll just do a reply all to the group tonight.
Andy.
I've got to be careful how I say this. I don't want to come across in the wrong way. I'm interested to know whether there is an increase in the number of reports or types of report, or whether we as a community have just got a little bit less tolerant.
That's a really good question. So I think in COVID, there was an absolute shift to people being less tolerant. Absolutely. And that has leveled off quite a bit now. I think, personally, I think what's probably happened is there's really strong strands of cannabis, marijuana, and it's really smelly. And so the availability maybe has increased in terms of, I mean, the police are incredibly busy dealing with a number of active county lines at the moment, which we're assisting with. I think the availability of strong weed in Dorset is quite high.
Not just weed, it could just be playing music or
absolutely, yeah. So I think
the way I describe it to my community, because I've got an active case at the moment that's going on, is society has a fair use policy towards society as a whole. There's a certain amount of, the neighbour has a party, that's fair enough. But the neighbour has a party every night, that's a problem. People park cars outside their home, that's fine. They park 7 cars outside their home, that's an issue. And it's an unwritten set of standards that communities are. And I think, has there been a change, do we think, in communities' fair use policy? If you see what
I mean, I could quite happily sit down and have a pint with you, Dan.
Yeah, that's the best compliment I've
I think that would be a pint of tea or coffee.
I'm driving.
Remember, we are online, please.
My personal opinion is we've made reporting a lot easier. So you can either go through the police, do the online form. You don't have to sit and wait on the 101 phone line. You can do that online, and then you can complain to us straight through asb@dorsetcouncil.gov.uk. My own personal opinion, I'm not backing this up with any sort of sociological expertise. I think personally, if I'm friends with my neighbours, I've got a really high tolerance level. They can almost annoy me with impunity because I'm their friend and I let them get away with it. I think social exclusion and the fact that we're all in our own sort of little silos, actually you lose the benefit of that. And where people are maybe transient and moving around, and maybe it only takes one person in a neighbourhood just to, I don't want to say lower the tone, but just to make things an awful lot worse. And then people do get to the end of their tether. I mean, we've got quite a few cases where just one individual is wreaking havoc on a whole neighbourhood, and we're struggling to work with partners to see who's responsible for trying to rein that behaviour in.
Our inboxes will reflect that.
I think society has shifted certainly after COVID, and we are seeing high levels of reporting, and we're also seeing, dare I say, reduced levels of resource, certainly among partners, which means that we're having to pick up the slack with that within our limited resource. And actually, we're sort of attacking problems based on threat, risk and harm, which means that some of those lower level nuisances aren't getting dealt with because we're worried about vulnerable people that might take their own lives or be at risk. And so I think there is a national shift in terms of what we're realistically able to deal with. That helps. Probably not.
It helps, but I'm not sure what I then do with it.
Rates in the list.
I think one of the issues is that those people that are in that bottom pool could end up having, because it's like the dripping tap, isn't it? It might be low level, but it's constant. And that can have catastrophic events long term. People's mental health. But talking about tolerance in society as well, I think the thing I've noticed most in the last 3 or 4 years is how selfish and entitled society has become. You know, whether it's at the traffic lights or anything, it's doesn't matter what the rules are, it's me. I think that's really sad because it's not the way I was brought up.
Some elements, definitely. Yeah, not everybody, thankfully.
No, not everybody. A minority, however. Before I took a deeper hole for myself. Any more questions? Carl, come on then, quickly.
Just well, when you're putting together these community safety plans, how do you actually get local people's views to actually put the plan together? And obviously, I think you've got a new revision for the next 3 years starting this year. So how did you get like a survey done to then inform what you were putting in that plan?
Yeah, thank you, Chair. So there have been various ways that we do it. Legally, we have to do a needs assessment. So it's a mixture of data and intelligence and everything that comes through agencies. But on top of that, we do try and do consultations. And some of those have been done by Dorset Council in the past. We didn't do one for this latest one, but we will be doing one this year. We did use one from the Police and Crime Commissioner's Office, who's one of our partners this year, to inform it. Having said that, really keen to do more of that, actually. And there's one thing doing a Dorset-wide survey which picks up people, but Councillor Bell and I were discussing about how do we get local views fed into things, and not just at the level of, because the community safety plan is a broad document, so you're looking at issues thematically around antisocial behaviour, sexual offences, domestic abuse. There are locality groups, as John mentioned, that are working in communities, and it's really important that resident community intelligence feeds in at all those levels. So now we've got those locality groups set up, we will be looking at how we ensure they get that information from communities and so on, and including from members and things as well that need to feed into that. So yeah, it's a good question, and one that I think we could worthwhile develop further as we kind of roll out. It's in line with the council's approach around community conversations and things as well. So
thank you. I'm not going to go into a great big spiel about recommendations because I think there's just a couple of small bits which George has captured. Because I've been thinking about so many other things, I haven't got it all in my head, if I'm honest. So thank you all very much for this morning. This afternoon now.
Yeah.
We have one item left on our agenda, and that's the forward plan. Two things, George. We have had 2 requests from members back in April about, one is NHS transport of vulnerable people for appointments, and the other was RP disposals, just a provider disposing of properties rather than doing them up. Yeah, back to housing. And there was a question there about asking them to come in and explain their policy and see what we could do to influence it. So those were 2 requests we'd had in, which I'd asked you to sort of get some feedback on so we can determine whether or not there's something that we want to put on the agenda. So I'm
something else we were discussing, wasn't there? What was it?
So I'm just trying to sort of see if we can get some feedback on that. So we can get them put on the agenda if we need them. Julia stayed here because on our next meeting, we were supposed to be doing a deep dive into community healthcare. Because of the inspection and various other things that are going on, particularly the changes in the NHS, Julie's intending to bring a scoping document to the October meeting, and then at the November meeting, bring forward a main report. So it's just been delayed a little bit to give a little bit more breathing space.
No, take the breathing space.
Yeah.
And
So
have a holiday.
Take a day off, not a whole day.
What's that? So the rest you can see it, they are what they are. I've asked George to look at the unscheduled items to see if we can start doing something with them, either if they're still relevant, if they're not relevant anymore, take them off if they need to go somewhere else, send them that way, or put them into the programme rather than have them just sitting there in limbo.
Yeah.
So that's true. Julie, was there anything you wanted to add about things going forward?
I think we decided that we would discuss some of the details of the stuff going forward outside, so that we make sure that
there's stuff bubbling where we just want to sort of,
if that's okay,
get our heads around it and see where we're going with that first. Is there anything from you guys that you want to see on the agenda for the full plan?
I know there was something, but I'll find it in email.
If you think of something,
I'll email.
Email myself, Jane, and George, and then we'll.
Yeah. Just please speak to IT about.
We've all had it this morning.
Just don't update during committee.
Can we please ask IT
Drop out.
program that it doesn't update during committees?
I can't leave. I can't stop it.
So.
8 minutes.
So we have no last one.
Nothing else.
That's business.
Lovely.
Thank you very much for your time. Good afternoon. I have a home to go to. Yeah. Thank you for your contributions today.
Thank you very much.
Thank you.
Well done for holding it all together.